Oh, maybe the dose 4 times a day, maybe taking 2 to 3 grams 4 times a day
To start.
to start. And now don't worry about meals. But now this, I think the most effective form is ascorbic acid. Now then this gets complicated if a person has ulcers. Well, this what I call the ascorbate effect, I find is more effective with ascorbic acid orally. Now we can get the ascorbate effect with sodium ascorbate intravenously, but I find that sodium ascorbate orally is not quite as powerful as ascorbic acid by mouth. Now, if you can't take ascorbic acid, like if you have an ulcer, it's like that. If I slap myself, that doesn't hurt, but if I had a sunburn, it would. So ascorbic acid on an ulcer may hurt. It may heal the ulcer after a while, but at first it might hurt. So then what we do, we sort of baby people into taking it by maybe 50-50 mix of ascorbic acid and sodium ascorbate, or even use other types of buffered vitamin C to build up. Now magnesium ascorbate is a great way to get magnesium in, but remember that magnesium is a laxative, so that doesn't count as far as the diarrhea is concerned if you're taking magnesium ascorbate. So that everything that I've been saying about titrating to bowel tolerance has been based upon the taking of ascorbic acid. Now, the intravenous, since you can't take ascorbic acid by vein, you need sodium ascorbate. But see, we figure that only about 1/7 of the ascorbic acid that we take by mouth ever gets into the bloodstream, whereas 100% of the sodium ascorbate that we take by vein, by definition, gets in the veins. So that we find that even though the sodium ascorbate is only about half as strong as the ascorbic acid, 7 times as much gets in the body. So it's about 3.5 times more powerful. So the doses of sodium ascorbate when we treat a disease by vein, like say if you have a 100-gram cold, that is a gram that would allow you to take 100 grams of ascorbic acid by mouth, probably 40-50 grams by vein would do it. But the thing is, since there's absolutely no side reaction to sodium ascorbate by vein, we found that we just put 60 grams inside of a 500 cc bottle of lactated ringers, and we give 1 or 2 bottles, so 60 to 120 grams. And so it's not a big deal as to how much it takes, because we can overshoot with complete harmlessness, you see. I mean, people just do not have a bad effect from sodium ascorbate by vein. So rather than risk not giving enough, we give too much. And the other thing, with a very serious disease, you would give the sodium ascorbate intravenously as fast as and as much as necessary to break the fever, to break the symptoms, you see. So that even though I haven't treated something like Ebola, if somebody had Ebola, I would be giving them intravenous vitamin C, maybe 180 grams a day, or maybe 300 grams a day, I don't know. Whatever it took, at whatever rate it took to break the temperature, to break the fever. I went into practice in San Mateo at Mills Hospital, and while I was there, I had frequent colds. I would have a cold every 2 months, and I also had seasonal hay fever. Now, the thing was that at that point, Linus Pauling was writing this book, Vitamin C and the Common Cold, and I was ready to try anything. So at that time, I, as luck would have it, got this powdered ascorbic acid, and I didn't know how much to take, so I took a level teaspoon, which turned out to be 4 grams, and was astonished that it knocked out my symptoms of hay fever in about 15 minutes. And then that lasted for about 4 hours, and then I took another dose and another dose and another dose, and at the end of the day I had taken 16 grams and was relieved of the hay fever. Well, I didn't catch a cold for about 9 months, but I did catch a cold then, which was a disappointment. But I noticed that after about 20 minutes to half an hour that the symptoms of the cold went away, but then they came back in about an hour. So I repeatedly took more doses, and by the end of the day I'd taken about 60 grams, blocking the symptoms of the cold, and the next day I was all well. Well, I thought that was rather interesting, so I tried this out on patients. And I found that without exception, in patients who have good stomachs, that is, no ulcers, no colitis or things like that, that the average person can take about 10 to 15 grams of ascorbic acid divided up into 4 to 6 doses for 24 hours before it produces this loose stool or diarrhea. The astonishing thing was that that same person with a mild cold could take 30 to 60 grams, a bad cold 100 grams, a flu 150 grams, and then I realized the magnitude of this phenomenon when this 23-year-old, 98-pound lady librarian came in with severe mononucleosis. She ate a pound of ascorbic acid in 24 hours, a pound of ascorbic acid in 2 days without so much as gas. This was over 200 grams per 24 hours. At first I didn't know what was going on here, but then I was talking with Erwin Stone, who had written the book Vitamin C and Vitamin C, the Healing Factor, and we decided that what was happening here was that these diseases caused the formation of free radicals, and that the ascorbate, when it destroyed the free radicals destroyed the ascorbate, and of the ascorbate, what doesn't reach the rectum doesn't cause diarrhea. That's why the sicker you are, the more you can take. And so we call this titrating to bowel tolerance. And this is why people are able to take these huge amounts of ascorbic acid. And to an extent, the amount of ascorbic acid that you can take when you're sick indicates somewhat how sick you are, how toxic you are. So anyway, I began to use these small amounts of ascorbic acid on patients post-operatively when I did their hip surgery at Mills Hospital. And it was amazing. These little old ladies who'd broken their hips were not taking many pain medicines, and they were getting out of the hospital in half the time. And some of them said they felt better than before they broke their hip. And everything went fine for about 3 months until the staff discovered what I was doing, and I was labeled a quack and all my referrals were cut off. Well, they couldn't bankrupt me because this prosthesis was bringing in royalties at that time. But I moved up to Incline Village, Nevada, where I was the first physician in town, and the people either had the choice of going over Mount Rose into Reno, which was difficult during the wintertime, or into Truckee, which was another snow pass. And so I was the only physician in town for the first three years, and I had half the town on vitamin C before the next physician showed up. Half the town thought I was crazy, and the other half thought I could walk on water, so that was okay. So anyway, that's where I got the experience with vitamin C and all those infectious diseases, was up at Incline Village, because when people come in who don't have any chronic diseases, they don't have troubles like ulcers and colitis and other GI tract problems. The average person who's eating sugar and despite that is in good health, and they're athletic and all that, and they just have their colds and flus and mononucleosis and hepatitis and gonorrhea and syphilis and diseases like that, the vitamin C just knocks the hell out of these diseases when you take it to tolerance. So that's where I got my vast experience with infectious diseases. Well, now, first of all, I ought to talk about maintenance doses. And maintenance doses vary from person to person. You could have kissed the wrong girl when you were 16 years old and gotten the Epstein-Barr virus, or herpes 6, or cytomegalovirus, or something or other, which maybe you didn't get sick at the time, but you carry this virus inside you and it produces free radicals, so that your tolerance to vitamin C might be higher as a result of that, you see. So that's one of the reasons why everybody's bowel tolerance to vitamin C varies as a maintenance dose, you see. And one person might, I mean, there are few people that get diarrhea as low as 5 grams a day. They're unusual, but they may be the ones who just have none of these little bugs in them at all, you see. Whereas if you have the average amount of bugs, you'll probably be able to take 10 to 15 grams of ascorbic acid a day. Now, some people who have like chronic fatigue and so forth will take 30, 40, 50 grams a day as a maintenance dose, you see. But then, getting an acute disease like a cold or a flu, everything is off. Instantly, you may be able to take 50 to 100 to 150 grams right then. And what we have found is that smaller doses more frequently are important. So this question about whether or not to take it with meals, it could be that you might want to take your ascorbic acid associated with meals maybe. It doesn't make much difference, but let's say you had a pattern for your maintenance dose, that would be okay. But when you're starting to take it for a cold, for instance, it's probably better to take it every 15 minutes to half an hour. Smaller doses, like I would rather see a person take 2 grams every 15 minutes rather than 4 grams every half an hour or a great 8 grams every hour, you see. And it turns out that the more frequently you take the dose, the more likely it is to knock out the acute symptoms. But for people with maintenance doses, usually 4 to 6 times a day is enough. But then if you get a disease like mononucleosis, you may be taking, like 6 grams every 15 minutes for a few hours. And you keep taking it until you feel sort of a reversal of the symptoms, or else you start getting diarrhea. And as soon as you get diarrhea, then you may want to back down on it for half an hour to an hour, see, before taking the next dose. Now, this sounds complicated, but actually you get a feel for it. You can feel this stuff working in your body. There will be a sudden relief of a lot of the symptoms, and then you match the relieving of symptoms with the onset of diarrhea to figure out the exact dose and the rate that you should take it. Well, then after doing this, say a maintenance dose, when you're not sick, after doing this for 2 or 3 weeks, you just know how much you can take at any particular time. And that's another thing, is that some people, particularly those with allergies, will find that their dose varies throughout the day. And so one might be able to stand a 6 gram dose first thing in the morning, but in the afternoon they've got to take 3 grams, you might say. Or it might be the reverse, you see. If they're building up food allergies, they might sleep it off during the night and be only able to take 3 grams first thing in the morning, but then as they eat they might take 6 grams or so. So there's a variable dose on this, but it sounds complicated, but the major thing is to listen to your body, and your body will finally tell you what to do, unless you have things like ulcers or some screwed up GI tract. Well, to partly understand how these massive doses of vitamin C work, one has to understand free radicals. Free radicals are molecules that have lost an electron, and they're very reactive because they want that electron back in the worst way, and they'll glom onto any other nearby molecule to join together. And when 2 molecules join together that shouldn't join together, then damage has been done. Now these free radicals mediate all inflammations. By that I mean redness, swelling, and pain. Now the ascorbate, by being an electron donor or antioxidant, neutralizes the free radicals, and so that's how it's able to knock out these inflammation. I wrote this article, The 3 Faces of Vitamin C, which tries to illustrate this point. One of the difficulties that people have with understanding vitamin C is because it serves several functions. First off, and the non-controversial things, is that vitamin C is a vitamin in tiny amounts, prevents scurvy. It's necessary for the buildup of collagen and dentine and the function of the immune system and so forth, but just tiny amounts are needed to do that. Well, so that just a few milligrams, maybe I think the recommended daily allowance is about 60 milligrams, and that easily does all those vitamin C functions. But then what happens when a person starts getting sick, or if they have any bugs in them, like a lot of people carry a little bit of Epstein-Barr virus or herpes 6 or candida, diseases like this create free radicals in the body which burn up the ordinary amount of vitamin C, which means that you have to take a moderate dose to be able to make up for this indwelling formation of free radicals all the time. These free radicals are aging, and so this slows down the aging process a little bit. But anyway, that's the second phase, is making up for this ordinary loss of free radicals, ordinary loss of vitamin C due to these free radicals with everyday living. Then, finally, is that when you really get sick with a cold or a flu or something, then the free radicals have overwhelmed the ascorbate in your body, and you're unable to produce enough electrons to keep refueling the vitamin C, and so that's when you start getting sick. Well, at this point you can throw away ascorbic acid. We're actually throwing away the vitamin C for the electrons carried. You see, most of the time the body is replacing the electrons that the ordinary doses of vitamin C lose in neutralizing free radicals. But when we get sick, that ability of the body is overwhelmed. So then we have this enormous amount of free radicals that are formed when we're sick. This is where the throwing away of ascorbic acid makes sense. So we're actually throwing away all this vitamin C for the electrons carried. So people who say that we're just wasting it and have the most expensive urine in town, they don't get the point. Is the vitamin C perhaps is coming out in the urine to a certain extent, but it's minus the electrons, and the electrons then have neutralized the free radicals, and that is what causes the reversal of the symptoms of these infectious diseases. Well, see, there's only been 1 or 2 days in medical school where they teach you about scurvy, beriberi, pellagra, rickets. The extreme absence of certain nutrients cause these diseases. They don't talk about this concept, and they don't believe this concept that as people get older that we get less efficient, or if we're sick we need more nutrients. I mean, for instance, to believe that you don't need more vitamin C when you're sick is about as stupid as to believe that it takes just as much gasoline to run a car 100 miles an hour as it does 10 miles an hour, you see. I mean, when the body is in a fight for its life, it needs these nutrients, you see. And so that's why the recommended daily allowance, we call it the ridiculous daily allowance, is just absolutely totally inadequate when a person is sick, or when they're getting old and inefficient in their absorption of nutrients, or if they have some genetically determined metabolic defect in their body. You see, I mean, you might have some defect where you lack the enzymes that you absorb zinc. Maybe you only absorb 1/10 the amount of zinc that you ought to. Well, but that's okay. You just take 10 times the amount of zinc, and then you totally bypass the block genetically, you see. So, but as far as the maintenance dose, Klenner had an idea that I have no objection to, is 1 gram per year of life up to 10 years, so 10 grams for a 10-year-old, and then adults would take 10 grams a day, basically. But I would add to this, too, that I think everybody should try to titrate to bowel tolerance and see where their tolerance is, and then lower that down to a comfortable maintenance dose. Now let's say, for instance, that your bowel tolerance is something like, 15 grams or just 20 grams or something like that, and you really push it. Well, and you're still young, and you haven't reached what I call the age of wrinkles, then maybe 5-10 grams a day maintenance dose would be okay. But let's say you're a young person and you find that you can take 45 grams a day without getting diarrhea. Well, then you know you have a burn-on in your body. You know you've got something that's making free radicals. Maybe it's an allergy, maybe it's Epstein-Barr, maybe it's herpes 6, maybe it's candida. But it's something where the body would benefit by taking near to bowel tolerance doses all the time. Now, one of the things that sometimes happens when you do that, let's say you find that you've got a bowel tolerance of 35 grams, and so you start taking close to 35 grams, after several weeks you may find that your tolerance is dropping, and what is happening there is you're probably knocking off the bug that was making the free radicals that allow you to take the 35 grams. See? So sometimes people will find that their bowel tolerance to ascorbic acid decreases over a period of time. Now, sometimes that will be permanent, but then sometimes if you say you're down to 15 grams a day, having been able to take 35 grams at first, and then you're down to 15 grams, and then let's say you don't take it for a few days, you may find that you suddenly bounce back up to 35 grams again. See, sometimes you will, sometimes you won't. Depends upon whether or not the body has been able to knock off the bug completely or not. Yeah, well, I tell you, if I feel like I'm catching a cold, my dose, now I've been taking big doses, my dose is 6 grams every 15 minutes until diarrhea. I mean, this diarrhea is not really diarrhea, it's just a soft stool, and you know, if you have one soft stool, so big deal, what else is new? So when the disease come, I just take it and take it and take it until suddenly you feel, oops, it's going to come, you see, and then you slow down and then back off of it. But the quicker the better, because if you can get saturated with the C, and in the case of a cold, you're trying to get your nose and throat saturated with the C, is you want to saturate it before this inflammatory cascade really gets going. See, the thing is that if the free radicals remember when the body makes free radicals because the body is damaged, these free radicals do more damage and cause more free radicals, and so there's this free radical cascade. So that if you hit it hard and fast at the very beginning, that's the best.
So 6 grams every 15 minutes, and you'd usually have that go on.
Yeah, well, it's the average person who's not had vitamin C before, I'd say 3-4 grams every 15 minutes.
For possibly a couple hours, or?
Well, yeah, or whatever it takes. I mean,
just to give them a basic idea of what they're looking. Is it going to be 3 hours?
Well, it depends. Well, see, they're 30-gram colds and they're 150-gram colds, so it sort of depends upon the epidemic. The one that's currently going around now, it's about 150 grammer. It's a bad one, and without the C, it results in a little bit of a bronchitis. And I don't know, other people are getting pneumonia. I haven't heard about that, but I've had patients come back or come in who didn't take enough C, who are having a little bit of a bronchitis. It's interesting, this particular epidemic doesn't cause too much coughing, but you can feel it in the chest. And but anyway, hit them hard and fast. And as I say, as far as I can tell, there's no toxic dose of ascorbic acid as long as you're taking it with water. See, I don't want anybody to be taking huge doses of ascorbate if they're dry. Now, to give an example, I had one person years ago who had a fungal infection and was given some 2 antibiotics by the infectious disease people that made him so sick that he wasn't eating or drinking. But he observed that when he took about 6 grams of ascorbic acid every hour, pretty much dry tablets, that he felt so much better. And so he did this for 3 or 4 days, and his kidneys shut down. And so then when they rehydrated him and he was off the ascorbate for a few days, fortunately he had gotten the yeast and he's perfectly okay. The kidneys had absolutely recovered. And the theory was that it was oxalate kidney stones, oxalate crystals, not stones, but crystals. And so out of 30,000 people, this has happened only once. And this guy was one of the biggest vitamin C takers I've ever seen. And that's why, and it was under unusual circumstances. So that's why I'm saying when you take ascorbate, make sure you do not become dehydrated, because this might happen. I haven't seen a snake bite yet, which is unusual because we have rattlesnakes in this area, not too much. But while I was up in Incline, this guy came in who had been bitten by a brown recluse spider, and he had this egg-sized lump on his forearm. He brought in this brown spider, and if he had just been bitten a few hours before, and what you expect is that he may slough this tissue down to bone with this thing. Well, I started massive doses of ascorbate, and the next day you couldn't even see where he was bitten. And Klenner had described this. So apparently, the ascorbate neutralizes the toxin of the brown recluse. And supposedly it neutralizes the toxins of rattlesnakes. And I can tell you that, like bee stings, the anaphylaxis, see, I think that anaphylaxis is acute-induced scurvy, and that we can prevent anaphylaxis with massive doses of vitamin C. When I first went up to Incline, they were in the midst of a beta hemolytic strep epidemic, and we could culture beta hemolytic strep out of everybody. And so I was giving them penicillin, vitamin C, and acidophilus. And I went through 300 patients and not a single allergic reaction to penicillin, which was highly unlikely because the published rate is about 3%. I should have had about 9 patients by that time who had an allergic reaction to penicillin. Well, anyway, one day this guy came in who'd gotten his penicillin elsewhere without the vitamin C, and he had the typical urticarial rash, the mosquito bite-like rash all over his body. And I seized the opportunity and gave him an intravenous injection of sodium ascorbate, and within 15 minutes the rash was gone. Well, this was about 1972, and so like a good physician, I prescribed him some Benadryl and sent him home, and the next day he came back for a follow-up visit, and he said, "Why'd you waste my money on the Benadryl? The rash never came back." And so I really do think that anaphylaxis is caused by acute vitamin C deficiency. And some of the other examples are like, if you give a patient with mononucleosis penicillin, about half will break with a rash. And if you give them ampicillin, virtually 100% will break with a rash. Well, what's world's champ at burning up vitamin C, in my experience, has been mononucleosis, you see. So that, you know, we have that situation. So that bee stings, if you take enough ascorbate, it takes the sting out of the bee right away and the swelling goes down. But it takes huge amounts to do this, because you've got to drive the concentration into the tissues involved by the disease.
So through intramuscular injection?
Well, I mean, I've never tried to inject the sting itself, but I mean, I always give it, you know, I've taken it orally myself. Frankly, this has been myself and my family that have been able to do this. People haven't come in for bee stings, but I've had patients tell me that they've been able to neutralize.
Even patients who normally have allergies to bee stings?
Yeah.
And maybe I could just have you state for the camera, anaphylaxis is what? It's the allergic reaction shock, right? Shock from an allergic reaction?
Yeah, that's anaphylaxis.
For pregnant women?
Oh yeah, well, again, we have a situation where I would modify his recommendations slightly depending upon what the woman's bowel tolerance was. But I think, as a matter of fact, the first trimester he would give them, 5 grams a day, the second trimester 10, and the third 15 or something like that. It's sort of interesting that when I first heard about this vitamin C thing and began to experience it myself, in Medical Tribune, there was an editor named Sackler who was a great medical philosopher, and he was very interested in all this stuff. And he published some letters about Klenner, and so I called Reidsville, North Carolina, the operator there, and asked for the local hospital. It turned out it was the Bonnie Doon Hospital, and I asked to talk to the head nurse there. And when I got her on the phone, and I said, "Well, who is this Fred Klenner?" And she said, "Well, he's a great doctor." And she says, "You must be calling about this vitamin C thing." And I said, "Yes." And she says, "Well, it works." And I said, "Well, do the other doctors do it?" And she said, "No." And I said, "Well, why not?" And she says, "Well, I don't know, but it works." And then she proceeded to tell me about the vitamin C babies, how healthy they were and how they didn't cry very much, and they would raise their heads up and look around as the other kids were ranting and raving. And as I say, in general, how healthy we were. And Klenner didn't do episiotomies, that the women didn't tear when they had birth. I mean, you figure we've been the product of millions of years of evolution. Why should the bottom of a woman tear when she's giving natural childbirth? Well, the fact of the matter is, it's because of all this nutritional deficiency. The tissues break down, they get stretch marks and all this, and zinc deficiencies and vitamin C deficiencies all have to do with these breakdowns of tissues. Well, when you give the person a good amount of all these nutrients, they don't tear. They just strictly stretch and have a normal childbirth and everything's okay. So anyway, that was my original introduction into ascorbate, is hearing about Klenner's work. Well, yes, they are trying to help cancer patients. I frankly think that the vast majority of physicians just don't believe that believe that vitamin C can do these things. They have, you know, when I went to medical school, they taught us a day or two of nutrition where they taught us about scurvy and beriberi and pellagra and rickets, and that was it. And the implication, very strong implication was that massive doses of nutrients above those certain amounts didn't do any good. And so I think most physicians who haven't had time to think about it really believe this, that it won't do any good. But the fact of the matter is that when we try these things, then they do have an effect. Now, why would this be? Now, when a person actually gets sick, they have some metabolic defects so that they may not be absorbing nutrients or utilizing nutrients the way that a healthy person should utilize them. Just for example, I have found that a large percentage of elderly people will feel a lot better with B12, folic acid, and B100 shots. Now, there's no precedence for that. I mean, the old GPs used to do this, but then when they got more scientific and they couldn't come up with any reason for this, they stopped doing it. Nevertheless, these people feel better. I have now had 3 ladies in their 90s who were pretty sharp, but they gave the history that they had to stop playing bridge a few years ago because they couldn't remember the cards anymore. Well, within a week of getting their B12 shots, they were out playing cards again. Now, so that the metabolic defect, see, we get inefficient in our absorption of nutrients, in our utilization of nutrients, and so forth like that, as we get older, or with certain metabolic, even genetically determined defects. And so that, let's say, if you have a defect where you're not absorbing zinc properly, then you might get something like acne. Here's an example, is that teenage boys very frequently get acne when they go through puberty. Now, somehow or another, this zinc deficiency creates a suppression of the immune system that lets this puny bacteria take advantage of this. Well, the conventional treatment for this is to use something like tetracycline to knock off the bacteria. But the problem is that that doesn't cure the zinc deficiency, and so that kid now, when he gets 50, 60 years old, is likely to have a heart attack from a zinc deficiency. So we look upon acne as a precursor warning sign of a zinc deficiency in teenage kids, you see. Now, if they didn't eat junk food, probably they wouldn't get the zinc deficiency, you see. So a lot of these things sort of compound up so that many of these diseases are caused by food and chemical sensitivity. Now, like, say, for instance, this recent thing about Vioxx. They say, well, you know, we've got to let it back on the market because even though it kills some people, these people's lives are being destroyed by their arthritis, and that everything has been done that could be done, and only Vioxx helps them. Well, it hasn't been done. In other words, a lot of people with degenerative arthritis are sensitive to nightshades, which are tomatoes, potatoes, eggplant, red and green pepper, paprika, tobacco. They've never been tried off those. And then there are other types of arthritis which can be caused by, like, milk allergies or gluten allergies or various different allergies. And they have never been tried off these foods, and they have never been exposed to a all-over program where they have been given certain nutrients like high doses of glucosamine sulfate along with vitamin C, zinc, manganese, chromium, selenium, and taken off the food and chemical sensitivities to treat their arthritis. Now, when all that is done, well, then maybe you can say that everything has been done that could be done. But until you do those things, no. The simplest things have not been done against these arthritises, so that it does not justify using a dangerous drug on them.
When you say arthritis, is all joint pain necessarily linked to that, or what else is recommended for joint pain? And
well, now see, joint pain, anything the matter with joints is termed arthritis. It means inflammation of the joint. So there are things like osteoarthritis, which is mostly a non-inflammatory arthritis. People get osteoarthritis of the fingers, and almost all of that is caused by nightshades. But then they get osteoarthritis of the hips and the knees. It may contribute to that, but that's not the only cause of those things. Then there's rheumatoid arthritis, the crippling type, which is sort of an autoimmune disease. And then there are various other, there's arthritis due to injuries and such. So there are different forms of arthritis. The reason why glucosamine sulfate is helpful for many arthritis, not necessarily curative, but you see, like, if a machine is wearing out, a joint in a machine, it just wears. Whereas with living beings, there is a wear-repair ratio that goes on, and that the glucosamine helps to speed up the repair. And as long as the repair keeps up with the wear, then the joints don't deteriorate. So at least it's something worth a try. And the other nutrients like vitamin C in high doses, zinc, manganese, chromium, selenium, cod liver oil for the vitamin D and the vitamin A, and anti-inflammatory prostaglandins like EPA, they're in cod liver oil, and fish oils in general, are all worthy of a try with all these different forms of arthritis before you start going to dangerous drugs. And these I say they're dangerous because they're not natural substances. We might say that these drug companies are obsessed with making things for space aliens, because the thing is that the natural substances of which we're made are excluded from investigation because of the patent laws. So that they have to change the natural substance into some unnatural substance to make it patentable. And so maybe that would be good for some space alien, but it certainly is not the best thing to try out first in human beings. The average person who's eating sugar and despite that is in good health and they're athletic and all that, and they just have their colds and flus and mononucleosis and hepatitis and gonorrhea and syphilis and diseases like that, the vitamin C just knocks the hell out of these diseases when you take it to tolerance. The other criticism was that it would cause oxalate kidney stones. Well, no one has ever been able to come up with a series of patients showing that it would cause oxalate kidney stones. Believe me, that would be an easily published article if anyone would be able to do that, and they haven't been able to do it. Well, but then the question is, why is it that ascorbate doesn't cause oxalate kidney stone? Because it's quite true that those of us who take ascorbate have high oxalic acid in our urine. Like my oxalic acid in my urine is 3 times normal, but no kidney stones. Well, it turns out that if you section a calcium oxalate kidney stone, there is always a nidus of infection in the middle of it. Now they're saying it's a nanobacteria. And the stone grows around this nidus of bacteria like a pearl grows around a piece of sand in the oyster. And so the thing is that we may have the most expensive urine in town, but we also have the cleanest urine in town, is that the ascorbate being spilled in the urine, when you take large amount, is sterilizing the urine. And in fact, some urologists are beginning to use this in people who have to have indwelling catheters all the time to keep them from getting infected. And so anyway, that seems to be the reason why we don't get kidney stones. I've given over 30,000 people massive doses of ascorbate since 1969, and I have seen 1 or 2 cases of stones, but they really weren't taking the high doses, and out of 30,000, I don't think that's very many. And as a matter of fact, at least in one of them, what we did was to up the vitamin C and give them B6 and zinc, and then they didn't, B6 and magnesium, and then they didn't have any more kidney stones. Adele Davis years ago had talked about how oxalate kidney stones resulted from a deficiency of B6 and magnesium, and we have found that to be true and a good treatment for these things. But I do say that people who take massive doses of ascorbate should drink a fair amount of water, and you should never become dehydrated when you're taking massive doses because you might actually get oxalate crystals in the urine. But there you won't have trouble as long as you drink a lot of water. Yeah, they're IgE allergies, and they can get breathing, cut down the breathing, cause spasm of the bronchial tubes, and have the heart stop and things like that. Hay fever and asthma, I'm not completely sure the absolute differentiation between the two, but I mean, the huge doses of vitamin C ameliorates most hay fever and asthma too, see. I mean, like exercise-induced asthma, forget it. You just give massive doses of vitamin C before you exercise. And then I realized the magnitude of this phenomenon when this 23-year-old, 98-pound lady librarian came in with severe mononucleosis. She ate a pound of ascorbic acid in 24 hours, a pound of ascorbic acid in 2 days without so much as gas. This was over 200 grams per 24 hours. Yeah, herpes has been a problem, but years ago in one of the Scandinavian countries there was a story about how low doses of lysine would help herpes. And it didn't seem to be statistically very significant. But we realized that lysine was a non-toxic substance, and so we gave higher and higher doses and found that the higher the doses, the more it suppressed the herpes. Now there was a problem having to do with herpes and vitamin C. I found that people who had chronic herpes would sometimes have an outbreak of herpes when they started vitamin C. And that didn't make sense at first, but then we realized that what happens if you have a herpes like on the lip, that it breaks out there all the time, there is an infection there between attacks, and when you have an attack is when your immune system is trying to kill the infected cells. So that's why when you stimulated the immune system it would create an attack. Now we found that this was more common with moderate doses of vitamin C. When we gave massive doses of vitamin C, right up to bowel tolerance right at first, that didn't happen. And then so anybody with herpes, we give them massive doses of vitamin C and also the lysine. And everything. We take them off sugars and zinc, manganese, chromium, selenium, and cod liver oil and such. Oh, and then we have zoster, shingles. And with shingles, we give them intravenous vitamin C and the triple B shots, and they go along with the basic program, but they go into remission quite rapidly and don't get this post-herpetic neuralgia when they are treated that way. I was the only physician in town for the first three years, and I had half the town on vitamin C before the next physician showed up. Half the town thought I was crazy, and the other half thought I could walk on water, so that was okay. So anyway, that's where I got the experience with vitamin C and all those infectious diseases, was up at Incline Village. One of the great names in orthomolecular medicine, of course, is Linus Pauling, who wrote this book, Vitamin C and the Common Cold. And I think it was published about 1970. But there has been another person, Abe Hoffer of Canada, who has done much work on this. He was a psychiatrist and came up with the idea that niacin would help a large number of schizophrenics. And then he combines it with vitamin C. It turns out that when niacin oxidizes, it turns out that in schizophrenia there is this formation of a substance called adrenochrome, which is a oxidative product of adrenaline. And vitamin C helps to prevent the oxidation of adrenaline, so this is what prevents the adrenochrome. And so that's why vitamin C helps many people with depressions. Adrenochrome is a depressive substance, and so that's why with some people that are depressed, vitamin C is the world's best antidepressant. But this thing about niacin, he came up with this. And I had one example of a patient, this beautiful young lady, who had already been in the Nevada state prisons 3 times for drug abuse and prostitution, who last time she was in prison was slipped a dose of niacin. Now this lady's mother was an institutionalized paranoid schizophrenic, and this girl had voices in her head telling her to do all these things. Well, when a social worker slipped her a dose of niacin, that all these voices stopped, and this raving maniac suddenly became this sweet, lovely thing. And so they threw her out of jail in 10 days. It was like Mr. Hyde had turned into Dr. Jekyll, and she didn't belong in jail anymore. Okay, so Greenwood years ago showed that taking vitamin C reduced the incidence of necessary surgery for back pain. Now, we've found that a large percentage of back pain is caused by herniated discs, and this is what we would expect. Of course, the tough part part that discs are made out of are collagen fibers, and if there is acute induced scurvy of the discs, you would have a breakdown of those collagen fibers and a herniation of them. So when I see people with back pain, I give them massive bowel tolerance doses of vitamin C. Also give them the zinc, manganese, chromium, selenium. I think manganese is very important for back pain. I'm not exactly sure why, but it has something to do with the metabolism of cartilage. Then we give them vitamin D and vitamin A in the form of cod liver oil, and the B vitamins and vitamin E. Every once in a while you'll find a patient with back pain who is markedly relieved of the back pain with about 50 milligrams of manganese 3 times a day. Now, you have to be careful of that and make sure that they don't get any shaking from that, but about 1 out of 10 people with peculiar back pain will be relieved by manganese. The other thing is cod liver oil in massive doses. Now, this is a precursor to anti-inflammatory prostaglandins, the PGE2 series, or PGE1 series, and that I have given as much as like 3 tablespoons of cod liver oil 3 times a day. Now, when you do that, they can only be temporarily, and you have to be careful of any extra bleeding and bruising, because massive doses of cod liver oil will sometimes be an anticoagulant. But with those things, and then having the person try to lose weight and giving them large amounts of glucosamine sulfate, is that we find that back pain usually goes into pretty much of a remission and doesn't require surgery. Now, of course, if there was a sudden nerve root pressure causing paralysis or difficulties with urination and bowel troubles, then that would be a cause for emergency surgery. But the typical low back pain usually goes into remission better with this kind of a program. Now, in cases of allergy, of course it's better to avoid the food that causes the allergy completely, but it is true that sometimes massive doses of vitamin C will take the edge off of allergies, so that can be used in conjunction with this other thing. Remember, people who have gluten sensitivities frequently have GI tract difficulties. Like I had one patient who had had 3 operations on his gut for ulcerative colitis, and had something like 80% of his intestines removed. And he came in to see me, and he was still having trouble with his GI tract. And we took him off of all gluten, and within a week, all his GI tract troubles were gone. Now, he was missing 80% of his bowel, and that was too bad. See, doctors don't look into food and chemical sensitivities the way they ought to. They're just interested in drugs, drugs, drugs. Well, Hugh Reardon in Wichita, Kansas, his idea was that these massive doses of sodium ascorbate given intravenously cause the formation of peroxide within every cell of the body, and that cancer cells are deficient in catalase. And so that's why that massive doses of ascorbate forming peroxide would selectively kill the cancer cell and not normal cells. And this is probably just a matter of amount. We've had the opportunity to see this work in a few patients. Some cancers seem to be exquisitely sensitive to moderately high doses of vitamin C, but for legal reasons and worry about malpractice and insurance won't pay for it, we've not been able to give as large of doses that we knew would be possible. And so, but we have good evidence that there are some people that are now doing this and curing a large percentages of cancer with intravenous vitamin C. So anyway, I began to use these small amounts of ascorbic, small amounts of ascorbic acid on patients post-operatively when I did their hip surgery at Mills Hospital. And it was amazing. These little old ladies who'd broken their hips were not taking many pain medicines, and they were getting out of the hospital in half the time. And some of them said they felt better than before they broke their hip. And everything went fine for about 3 months until the staff discovered what I was doing, and I was labeled a quack and all my referrals were cut off. absolutely no sugar, including no fruit and no sugar substitutes, large amounts of acidophilus, large amounts of garlic or aged garlic. You know, the problem is that when it's Kyolic garlic is okay, but not quite as good as raw garlic. Time-release caprylic acid, maitake or Pau d'Arco tea for the tannins. And when you do all those things simultaneously, usually the yeast goes into remission. I use massive doses of nystatin powder only about 1 out of 5 patients. If this other doesn't completely get it, and I sometimes think that the ones that don't get better on this basic program are really not following directions completely. So we give them massive doses of nystatin. People are funny. They love drugs. I mean, I swear to God, it is amazing. I can talk till I'm blue in the face about garlic knocking out yeast, and yet all they can hear is nystatin. And then every once in a while, about 1 out of 10 or 20, they will use diflucan. But I haven't had to get into any of these other massive drugs. But we use huge amounts of nystatin. You know, the nystatin that's used by a lot of doctors come in these little sugar-coated pills, which don't have much nystatin. And anyway, how come you give sugar-coated pills to anybody with a yeast infection? I can't figure out. Anyway, see, the reason why they work is that if you take an average person, it's easy to get rid of yeast infection. You just knock off 90% of the yeast and they take care of it. But the patient with chronic diseases get this chronic candidiasis thing, which isn't exactly an infection. It's an acquired allergic reaction to this yeast, so that the normal amount of yeast that a person has in them, they are having an allergic reaction to it. And so that's why we have to be so absolutely fanatical in getting rid of it, you see. And you never can get rid of it completely, because you have it on your hands, your food, your partners, and all that have yeast. And so you're reinfected with it all the time. So you've got to keep suppressing it constantly. And that's why I like to use this anti-yeast program, that if necessary, you can keep it up the rest of your life. And you don't have to be taking a drug the rest of your life. See, all these easy, magnificent results I got up at Incline Village with these otherwise healthy people. Now then, unfortunately, we have the situation where in more civilized areas, it's the chronically ill people that get interested in orthomolecular medicine, and they are a pain as far as ascorbic acid is concerned. I mean, they have ulcers, they have food and chemical sensitivities, they have all sorts of ideas about what they're allergic to and not allergic to, and you got to fight all these things, you see, and you have to almost baby them into it. And so that's why that part of the skill of all this is that you put them on the anti-yeast program, which cleans up the bowel, which then maybe they become more tolerant to the C. Sometimes you have to give them 50-50 sodium ascorbic acid mixes at first. They may have, some people have tremendous amounts of gas with ascorbic acid. Now, the average person off the street doesn't do that, but these chronically ill people, sometimes they'll have tremendous amounts of gas. And so then we have to have them watch the foods that they eat. See, because there's no question that ascorbic acid in low doses causes little gas, moderate doses, moderate gas, large amount of gas, huge amount, no gas. It's interesting that it seems to kill the bowel flora that makes the gas, and huge, but I mean about 100 grams or so. If you have a cold and take these huge doses, you think it would blow your guts out, but it doesn't, you see. But then an interesting thing, you're killing the flora. Well, you worry about a staph enteritis or something or other like that happening afterwards. I have never seen an adverse flora grow back first when a person took massive doses of ascorbate, which is an interesting phenomena. I think maybe the reason for that is that for millions of years of evolution, the animals had ascorbate in their bodies, and the bacteria that we grew up with in the evolutionary sense were used to ascorbate, and now it's the bacteria and fungus and so forth that grow in sugar in the junk foods that we eat now that are pathologic, and they are knocked off by the ascorbate and don't grow back as well as the good bacteria do. Well, I think the big killer in this society is sugar. You know, we eat over 100 pounds of sugar a year, which is just totally ridiculous. And this consumption of sugar causes the growth of certain undesirable bugs, particularly Candida, in our gut, which then can cause different reactions. And some patients who get sensitive to this Candida thing, we call it chronic candidiasis, then can't eat any sugar at all. I have patients with chronic candidiasis that the sugar of one grape will make them sick for a week. And so they have to stop even fruit sugar. But I mean, everybody knows that sugar rots the kid's teeth, and yet they let the kid eat sugar. You know, it's like, here kid, it's Christmas, you can have your poison. You've been good, you can have poison. It's your birthday, it's poison. Easter, it's poison. You've been bad, you can't have your poison. I mean, it's really ridiculous. And so we should stop eating and feeding our kids all this sugar. Now, as far as fats, I want to keep people away from the trans fats and all that, but a good high quality saturated fat, that's okay in moderate amounts. And the proteins in moderate amounts. I mean, I'm sort of on the Atkins way. Now, I caution people against what goes under Atkins' name right now, because there are some things that I think Atkins would turn over in his grave over that go under his name right now. But you look at his original books, and he was really pretty much high protein, moderate fat, and low carbohydrate diet. Now, they keep saying that, well, you can't stay on this. Well, I have hundreds of patients that stay on this type of diet. They lose weight on it, they feel great, they can't figure, they just have no difficulties doing that at all. Now, a lot of people who have difficulties in getting off of and staying on a diet is because they crave the very food that they're sensitive to. And this is one of the big problems. Is like, for instance, if you go to Weight Watchers and they allow you to eat small amounts of carbohydrate or some food that you're allergic to. Now, they don't know it, you don't know it, but you might be allergic to one of the foods like bread, and yet they allow you to take a little bit of bread, so you never lose the craving for bread. See, whereas that I think maybe with the help of an orthomolecular physician or a clinical ecologist or somebody who understands food sensitivities, that you can figure out the foods that you're sensitive to and don't eat any of those foods, and that stops the craving. And 9/10 of the time, the person loses weight on that, you see. So that this idea of suffering by cutting down on the food that you eat, just cutting out calories, is, I think, ridiculous, because everybody knows people who eat all the time and they're skinny little things, and yet you have other people that eat just a little bit and they get to be fat. So, you know, scratch that theory. One of the reasons why people gain weight on carbohydrate and not so much on fats, and I realize that fat rhymes with fat, but that fats and proteins break down slowly in the body and don't raise the blood sugar very much. So most of that glucose which comes out of this is burned up as energy, whereas carbohydrate digests rapidly, raises the blood sugar, and so then the body secretes insulin and the insulin drives the glucose into the cells as fat. Also, when you're in this situation for a long time, it makes you relatively insulin resistant, and then this can cause diabetes, type 2 diabetes. So that's why I'm so totally against these huge consumptions of sugar. They're going to try and push it across on the United States and Canada based upon the idea that to be part of the World Trade Organization, they've got to have continuity of laws. Well, you know, this was pushed by these chemical companies that know darn well that the more vitamin C and the more nutrients that are sold, the less drugs are sold. I mean, vitamin C used properly would bankrupt every hospital in this country. Yeah, well, all I know is that, what was it, in that polio epidemic before 1949, was it he treated something like 60 patients? I mean, I don't know my numbers.
It was 60, it was 60.
Yeah, and that he gave them these injections of sodium ascorbate, and every one of them recovered. Well, it seems as though that polio is this puny viral disease that only lasts for a few days, except that it puts out this free radical toxin that destroys the anterior horn cells of the spinal cord, and that causes the paralysis. Well, but this free radical toxin is neutralized by ascorbate. So that you give enough ascorbate, it simply neutralizes the toxin, plus the vitamin C seems to help to knock off, or allow the body to knock off the polio virus, and so that's why he was able to cure polio. Well, nobody would listen to him about this, I don't know, the Salk vaccine came out, and the Sabin vaccine came out, which quieted the public down. Well, some of the arguments that have been used against vitamin C is, first off, there was a study which in young, healthy men, which showed that when you take over 2 grams, that there is a saturation of the bloodstream and the rest of it spills out in the urine. Well, this is not quite true. What we are interested in is the amount of ascorbate in the tissue involved by the disease. So think of the analogy of a big pie pan with just narrow edges, and that you can't put in water fast enough to bring the level up over the edges of the pan, that it all spills out. But what the diseased areas, it would be like a hole in the center of the pan. And what we're interested in is the amount of ascorbate that goes down into that hole to neutralize the free radicals generated by the disease. We don't care about the ascorbate that's spilled over the sides. And that's the reason why these studies of blood levels of vitamin C don't really indicate anything. What you've got to do is find the levels of ascorbate within the cells of the diseased tissue. But actually, I don't know how you do that, but you really don't have to, because the fact of the matter is that when you use doses high enough, it simply erases the symptoms. It just always does it. And so there's really not much reason to do double-blind studies and stuff like that. So so far we just have had no blood problems with ascorbate. The blood just seems to love ascorbate. The kidneys seem to love ascorbate. The liver certainly, it detoxifies things, you know, and the liver is the great detoxifier, and all it does is it takes some of the job away from it. So all these stories about ascorbate being toxic to the body in different ways, I just have not seen it. This brings up a very interesting point about experts in medicine, is that if you go to court and they get an expert on vitamin C, this will be somebody who maybe is the head of the nutrition department at a hospital or something rather like that, and he's considered an expert. But he hasn't used massive doses of vitamin C on anybody, and he doesn't refer to the studies of anybody who has the massive dose. So I mean, Webster's Dictionary's got this peculiar definition of expert, somebody who has experience, whereas in the medical profession, an expert is one who says what the orthodoxy wants to hear. And so that if you're an expert in vitamin C, you become a quack. Because I tell you that I could name 10 or 15 people around the world who actually use massive doses of vitamin C in patients, and they all agree with each other, you see. But they're not the ones that would be brought in if there was a trial or anything, you see. You know, how many times have you heard of people going in the hospital for one disease, and they're about ready to get well, and they get another disease, and then they just sort of die? Well, see, it takes several weeks for real scurvy to develop, and so that the first disease may start the scurvy out, and then the second disease finishes it off, and that kills them. And so they start getting all these secondary infections and all sorts of trouble with blood coagulation, bleedings, and stuff like that. And so I call the hospital scurvy houses, is that they should be using massive doses of ascorbate. I tell you, if I was czar of medicine, everybody who was admitted to a hospital would have intravenous vitamin C going, or else the doctor in his own handwriting would have a 10-page handwritten report as to why not, you see. And we'd stop this, but it just, when people get sick, see, that's the whole thing about this titrating to bowel tolerance and what it revealed. was that when a person with mononucleosis can take 200 grams of ascorbic acid a day without having diarrhea, it takes a fool not to recognize that something is happening, that vitamin C is getting burned up at this tremendous rate. Well, the reason why you don't die suddenly is because it really takes scurvy a few weeks to kill you, you see. So by that time, in most cases, the antibodies have gotten rid of the disease, and so the person slowly recovers. You know, they may be fatigued for a long time and have this and that complication. But if you're able to, you know, avert this whole process by giving massive doses of C, they snap right out of it. Now, there have been other studies, like the Mayo Clinic study. I really don't remember the details. It was so Mickey Mouse. I mean, they used patients who had had chemotherapy before, and they only did small amounts and so forth. It just wasn't valid. And besides that, when Linus Pauling was on the right track about vitamin C and cancer, but when he wrote the book, he didn't realize the massive doses that would be necessary to do this in some cases. And so now, as we're getting to higher and higher doses, we're getting better and better results. Because, as I say, the treatment of cancer doesn't depend upon neutralizing of free radicals, in my opinion. It has to do with this formation of peroxide in every cell of the body. Well, see, I'm not too much into the becauses here.
Okay.
All I can tell you is that first off, you have to realize that type 2 diabetes is insulin resistance, not that there's a defect in making the insulin, it's the body's utilization. So, first of all, we don't like any of the oral hypoglycemic agents. I saw Julian Whitaker give us a talk on that. He had a list of all the oral oral glucose diabetic medications, and he had red letters across, garbage, you know. And he's able to get most people off of insulin, and I have been able to get most people off of insulin. You put on an absolutely no sugar diet. Now, I think we ought to talk about this a little bit, is that this sugar mania we have in this country is crazy. Half the population is like alcoholics, they're sugarholics. And if these people get off of sugar completely, I mean absolutely completely, no sugar substitutes, no nothing, even stevia. If you're a sugarholic, you don't want to eat stevia, because that's like a wino telling a wino, look, you can't drink wine, but take the cork from the bottle and carry it in your pocket and smell it all day in emergencies, you see. No, these people after 2 or 3 months of absolutely no sugar tests whatsoever will say, what have I been doing all my life? You know, they feel so great without it. So this sugar mania in this country is just totally ridiculous. The other thing you look for is every once in a while there'll be some sort of an allergic reaction to something. Like that one of our colleagues named Philpott did a study where he did glucose tolerance tests on people after testing them with certain foods. He found that sometimes certain food sensitivities would cause a diabetic reaction. So, like with everybody with chronic problems, we look for any foods that they might be sensitive to. But in general, we get them off the sugars completely. Then, as far as the nutrients are concerned, we give them the massive doses of vitamin C, zinc, manganese, and chromium, remember, is the glucose tolerance factor, so we give them chromium, and also vanadium. Has a insulin-like effect on some diabetics, and then the B vitamins and the cod liver oil, and then there's this herb called Silvestri Gemini or something like that that we sometimes give to the diabetics. But now, if a person's come in and not on large doses of insulin, you can just start off this big program of whammo. It's just fine. But if a person comes in on high doses of insulin, you've got to initiate this program very slowly, or else they will have a hypoglycemic attack if they're still taking insulin, see. So they have to lower their insulin in order to go on this program. EDTA chelation. You know, Gary Gordon founded this ACAM, and they chelated with this magnesium EDTA by vein, which the magnesium EDTA goes in And first thing it does, it pulls out all the lead and cadmium. And then the second thing it does is, see, as we get older, we get a higher amount of intercellular ionic calcium. And the magnesium EDTA takes the calcium out of the body and puts magnesium where the calcium was. And that seems to be a benefit. It does not cause osteoporosis. You might say, hey, you take calcium out of the body. Well, the thing is that, if you talk to the really smart bone pathologists, they will tell you that osteoporosis is not a calcium deficiency disease. It is a bone matrix deficiency disease. That is, the protein part of the bone doesn't form. If you do sections of bone of osteoporotic women, 100% of the bone is calcified. There's no uncalcified bone. It's just that there's not enough bone matrix. And so that's one of the reasons why all this forcing of calcium and worrying about calcium has not solved the osteoporotic person problem. The thing is, what you want to do is to build up the bone matrix, and one of the symptoms of scurvy, by the way, is osteoporosis. And so you give them the vitamin C, and you give them zinc, manganese, chromium, selenium, the cod liver oil for A and D, the D is important there. And all these things help to build up the bone matrix. And I realized years ago that patients that had been on this program for years and years and years didn't have osteoporosis. And so this brings up another thing, is people with food and chemical sensitivities are making adrenaline and or cortisone, to block their allergies. And I find that the garden variety neurotic that you see is an adrenaline maker. They can be bitchy and off and on and so forth and so on. They're hyperactive, they're the workaholics, they can be millionaires and then have heart attacks. Though the cortisone type person is heavier set, collects fluids, has a higher incidence of cancer, and also a higher incidence of osteoporosis. One of my theories is that endogenously produced cortisone causes osteoporosis also. So this is one of the other things we're trying to do, is to get away from food and chemical sensitivities to get rid of osteoporosis. Oh yeah, well that has to do with the renal threshold, is that let's say, for instance, if that study that shows that there is a maximum effect at 2 grams a day, that just means that if you take over that amount, it is spilling out in the urine, you see. But it was in the bloodstream to get there. But now if then there is some black hole in the body's metabolism somewhere where there's generating huge amounts of free radicals, then that extra dose of ascorbate will go down that hole, you might say, rather than going out in the urine. I mean, quite obviously, if the average person gets diarrhea, now see, when they take an overload of vitamin C, first of all, most of it goes out in the urine, but finally it gets to the point where it creates diarrhea, and you're losing it through the stools. But so that if the average person with a strong stomach is getting diarrhea at 10 to 15 grams per 24 hours, but then that same person can take 200 grams when they've got mononucleosis without diarrhea, obviously this is going somewhere, and we think what it's doing is neutralizing the free radicals generated by the disease process. So that all of these studies that are working with people who are well just don't have anything to do with this thing that we're talking about with the treatment of disease. It's the people who are sick that should be studied and find out what the devil is happening with these huge doses of vitamin C when you're sick. Well, Linus Pauling, for instance, had written several articles that were refused by medical journals. I myself have tried to send letters to the editor of very different journals, and they won't publish them, although I did have one letter that got accepted to Lancet about the increasing bowel tolerance with various different stages of AIDS. And then when they published that, I followed it with another article about how bowel tolerance was increased in all sorts of diseases depending upon the toxicity, and they wouldn't publish that. So my experience with talking to physicians, like when I go to Stanford and talk at their conferences, they just won't listen. And there just seems to be a resistance against this. And like I say, when I was using vitamin C in my orthopedic practice in Mills Hospital in San Mateo, all my referrals got cut off. And I had to move up to Incline Village, where I was the only doctor in town. And so the basic approach then has been to approach the public and have the public understand the effects of ascorbate. Because actually, after you understand how to titrate to bowel tolerance, if you have a good gut, then you're able to knock out a lot of the various different infectious diseases that affect us, colds and flus and things like that. You know, if you have a complicated disease, like an autoimmune disease, or you have food and chemical sensitivities, massive doses of ascorbate may be helpful, but you need a professional to help you do it, because you'll have all sorts of troubles taking the amount of ascorbate necessary. But just the average Joe off the street who's eating junk food and still relatively healthy, maybe he's going to have a heart attack when he's 60 years old, but as a young person he's still healthy and he has no allergies and all that, and then he gets a cold or a flu or mono or hepatitis or something or other like that. These people can learn to knock the hell out of these diseases with massive doses of ascorbate. And so that we're hoping that by getting the public knowledgeable on how to do this, they will force the physicians to do it. Now, as time has gone by, more and more physicians are getting into this. It's a slow process, but now right now we're worried about this thing called Codex in the European Union, where they're trying to outlaw these massive doses of nutrients. And this is just a gross attempt at trying to sell drugs, because obviously people who, well, myself as an example, with my hay fever, I took 2 or 3 antihistamines a day for years and years and years. And since my discovery of how to treat it with ascorbate, I don't use antihistamines anymore, and darn few antibiotics. And so that it's a disaster to the drug industry if people learned how to use proper doses of ascorbate. So we have to understand that what they're trying to do with Codex is to prevent the use of these nutrients, because they cut down on the sales of drugs. Now, of course, this is genocide, but that doesn't make any difference. Irwin Stone thought that the reason why people had difficulties with heroin, and also we find that ascorbate neutralizes barbiturates and cocaine and morphine and things like that, is that Irwin Stone thought that there were receptor sites in the brain which were receptor sites for ascorbate, which are empty in the case of humans, and that these various different molecules fit into those receptor sites, and their other end sticks out and does these crazy things. But these receptor sites far prefer ascorbate, so that when you have a person like with heroin, you flood them with sodium ascorbate, and it knocks out the ascorbate, or knocks out the heroin out of their brain, and they don't have withdrawals. And then the chemicals that we eat. I mean, there are things like aspartame, which break down into a small amount of methanol, and which is sort of a brain toxin. And it's only a tiny amount, so that only the people who are most sensitive have trouble with it. Now, this brings up the subject of chemical sensitivities, like take mercury. Now, any fool knows that mercury is toxic, but it's a matter of amount. Let's say the tiny amount which is in mercury fillings probably doesn't obviously cause trouble in the vast majority of people. I mean, maybe it knocks their IQ down 5 points. I don't know whether it does or not. But there is a significant minority of people who are very sensitive to this mercury, you see. And so the dental profession will be arguing toxicity all the time, when we should be thinking about sensitivity, you see. And there are just some people who just cannot tolerate the slightest amount of mercury, or some people, for some reason or other, they can't stand the slightest amount of formaldehyde or perfumes or things like that. That's why that the average person tolerates the glues under the rugs, or the chemicals coming off paints and stuff like that. But there is this small minority of people that are so sensitive to these things that they can't tolerate these things. Now, vitamin C in high doses increases the tolerance to these things to a certain extent. I don't like to see people be exposing themselves to chemicals because they're able to stand them with ascorbic acid if they're sensitive to them. But it does help. We have many chemically sensitive people like who can't stand perfumes, which they find if they're saturated with C all the time, then they can go into crowds where women will be wearing perfumes and function pretty normally. Sometimes they can't, but sometimes they can. So, but then of the other nutrients, like arthritis is very, of the fingers, the distal joints of the fingers is very frequently caused by the nightshades, tomatoes, potatoes, eggplant, red and green pepper, paprika, and tobacco. Many of the GI tract troubles are caused by gluten. Now the medical profession recognizes celiac disease as being caused by gluten sensitivities, but I'm here to tell you that a lot of irritable bowel syndrome and ulcerative colitis and various other diseases of the gut are also aggravated by gluten, and so one should always try to be off gluten sensitivities. And then we mentioned before that gluten can sometimes cause schizophrenia in some very susceptible people. We talked about the acne deficiency at puberty sometimes causing acne, the zinc deficiency at puberty sometimes causing acne. The B vitamins, the B12 deficiency, the folic acid deficiency. There's a great amount of interest now in homocysteine being the cause of arteriosclerosis. And now they're saying that certain neurologic diseases, even Alzheimer's disease, may have a certain component of homocysteine being a cause of this. And this could be countered by taking a folic acid. So the person who has a defect in folic acid deficiency, folic acid metabolism, might not be able to get by on the folic acid that the average person is able to get by on. And particularly as they get older, they can't get by on that amount. So that's why supplementing with this thing. Now, one might say, well, this is not natural. Well, believe me, I'm not all in favor of what's natural. I want to point out that rattlesnakes and black widow spiders are natural. And so not everything that's natural is good. And but so that as our metabolism gets less efficient as we get older, and one of our objectives is try to live older comfortably into older age, this then gives us justification for doing some unnatural things, but usually with natural substances. You see what I mean? To counter a deficiency in the metabolism of a certain natural substance, you don't want to take a drug, you want to take more of that natural substance to compensate for that inefficiency in metabolizing that substance. I mean, this is also terribly logical. Why can't people think this way? Because it's not patentable. It doesn't pay a drug company to push this, you see. And so these natural substances don't have sponsors. You know, I think one of the great theories of medicine, you know, these quackbusters are considering, they're saying that we're not being scientific. Well, the way I learned the scientific method was that you did experiments and the facts should determine the theory, not the theory of the facts. I mean, I'm constantly having doctors tell me that vitamin C can't do this and that because of such and such, you see. Well, but the fact of the matter is that it does do it, so they should change their becauses because of this. Now, as I say, I've given over 30,000 patients massive doses of vitamin C since 1969, and we have just not seen any increase in cancer. And in fact, if anything, we've seen a decrease in cancer. So that if in vitro there are different studies that show this and that chemical may be changed, I'm not very impressed with that. I just really didn't pay much attention to that because it just didn't happen. See, the facts should determine the theory. And the fact of the matter is that vitamin C is just simply not toxic. Now then there's the problem of Coumadin. You brought up the coagulation of the blood. And there's some thought that ascorbate would neutralize the effect of Coumadin. Now, I have never had a patient who was on Coumadin who was taking massive doses of ascorbate who had any difficulty with this. But one caution I would make would be that if you are taking ascorbate, when they're adjusting the dose of the Coumadin, and you're taking a dose of Coumadin, assuming that you're taking a certain amount of ascorbate all the time, don't stop the ascorbate suddenly, because the Coumadin then might make you bleed to death, you see. But as far as blood clots being caused by the use of ascorbate despite the taking of Coumadin, I haven't seen that happen. Basically, I would say that where medicine is really going wrong these days is that the drug companies can only research drugs that are patentable, which means that all of the natural substances of which the body is made are not patentable. Now, it takes $200 million to get a new drug through the FDA. So who's going to spend $200 million trying to get a natural substance through the FDA, you see? So they say, well, it hasn't been proven scientifically. Well, the definition of proving something scientifically is to spend $200 million to prove a drug to the satisfaction of the FDA. And we see what happens there is drugs like Vioxx get approved that sometimes kill people, whereas nobody can come up with $200 million to prove that vitamin C helps people, you see. So therefore, vitamin C in their mind is not proven scientifically. Now the other thing was, and I don't know how important this is, I had a patient up at Incline whose job was with the Improvement District, and his job was to culture the water in the lake and the water going into the sewage plant and the water coming out of the sewage plant. And he was convinced about how ascorbate worked, so he took a liter of water and put a drop of the feces-filled water going into the sewage plant into this liter of water, put a gram of ascorbic acid in it, shook it up, and cultured it every 15 minutes. In 2 hours it was sterile. So there is a direct killing effect of ascorbic acid, at least, on bacteria. So there's just so many experiments that could be done. But all I can tell you is it works. Well, perhaps. I don't have much experience with that. I have sometimes people make a little paste out of sodium ascorbate, just mix it with water, and some people have shot some up their nose for sinusitis and gargle with it for sore throats, and we've also put it on lesions on the skin. There was one very optimistic thing the other day that I don't know whether I can agree to it. They said that since cancers are susceptible to vitamin C, that if you have a skin cancer and you put vitamin C on it, sodium ascorbate, if it's cancer, it'll go away. I would hate to try this on melanoma alone, but I have seen some people who have had the basal cell carcinomas on the forehead and so forth, which when they put this vitamin C paste on, it seems to take care of them. And on the tips of the ears sometimes. Yeah, well, you see, B12, pernicious anemia, one of the symptoms of pernicious anemia is the neurologic. See, there's an anemia part and there's a neurologic part. This brought up an interesting thing, is that back 50 years ago, when the cause of pernicious anemia was discovered to be malabsorption of B12, and they started giving B12 shots. Now, for a few years before that, they knew that a person with pernicious anemia could go into remission by eating a pound of raw liver a day, but that was, better than death. But anyway, it worked. But anyway, pernicious anemia has two aspects. One is the neurologic and the other is the anemia part. Well, it turns out that folic acid would cure the anemia part, but not the neurologic part. And so that's why laws were passed to prevent the use of folic acid in multiple vitamin tablets over a milligram, you see. So that's why you see all these tiny doses of folic acid. And unfortunately, there's been a tremendous number of birth deformities, sphingomyelia, where the spinal cord comes out of the kid in the back due to folic acid deficiencies because of this dumb law. You see, their thought was that if they allowed folic acid out in large amounts, that there would be people walking around who had pernicious anemia, that the doctors would think they had multiple sclerosis and not realize that it was pernicious anemia that could be cured with a B12 shot. So my thought is the doctor ought to be able to tell that, and maybe if somebody comes in with anybody who comes in with anything neurologic in my practice automatically gets B12 and folic acid to see what it does to them, you see. I mean, giving the shot is cheaper than the test. And so then you give the shot to see how the person responds to it. It won't hurt them. And and a lot of elderly people lose their memories, and I think that a lot of what's considered to be senile dementia or Alzheimer's disease can be prevented with B12, folic acid, B100 shots.
What kind of a dosage would you recommend for?
Well, again, we do this standard thing of 1 cc of each one of them and see how long the kick lasts. Now, when the person starts giving themselves their own shot, we try and teach them how to do that. Then I'll tell them, okay, vary the dose. Maybe take a half a cc of B12 and a half a cc of folic acid and 2 cc's of B100. See how that works, and then alternate around, see which one works the best. And so they find out something that meets their own biochemical individuality. See, I mean, this is the key. One of the major keys of orthomolecular medicine is to see, we're not interested in a statistical average of how a drug works. Like, you know, you do a double-blind study on 1,000 cases of a certain disease and study a drug. And let's say it cures 2 of them, but then they say that's statistically not significant. Well, it sure was statistically significant to those 2 people, see? And so we recognize biochemical individuality, and then we try and match the treatment with the person. And this involves a lot of trial and error, you see, and a lot of history taking. And so far, the tests are not that great. I mean, maybe we're getting better and better at the tests, but I think the major thing is to try these nutrients on people and see how they respond to them. Somewhat, but now that's autism is a complicated subject. And I think it is largely caused by mercury, either from the mothers, their amalgam in their teeth, or the shots, the thimerosal that they're getting. So if we get them young enough and do chelation with DMSA, and also treat them for yeast. You see, the problem is these things get interrelated, because if you get a toxicity from mercury, this sets you up for candidiasis or one of the other viruses, you see. So there's an interrelationship: chronic fatigue, chronic candidiasis, hypothyroidism, thyroiditis, Hashimoto's thyroiditis. All of these diseases are interrelated, and now Lyme disease is partially one of these things. And so, but if we treat all these, and then we get quite a few remissions. If you get them before the age of 2 or 3, later than that, it's more difficult. But there's some improvement. Another problem that we have, like with the treatment of hepatitis, acute hepatitis, A, B, C. I don't mean chronic hepatitis. I mean acute hepatitis. Is that my experience has been that intravenous vitamin C knocks out acute infectious hepatitis so easily and quickly that it's unethical for me to do a double-blind study. I mean, if a patient comes to me and has hepatitis, I know this treatment works, and so we do it. It always works, and it would be unethical for me not to give a patient intravenous vitamin C. So therefore, it can't be proven scientifically. Yeah, well, there was a story years ago about this one black fellow who had a burn the size of a silver dollar on his hand and was given intravenous ascorbic acid. Now, that's what the article says. And then he died of kidney failure. He had G6PD deficiency, and there's a thought that G6PD deficiency would cause hemolysis of the blood if exposed to ascorbate. Well, that never did make sense to me. I never was able to get with the authors of that book, of that article, and they did say ascorbic acid, not sodium ascorbate. And I mean, you just don't give ascorbic acid intravenously. So I don't know what was going on there, but I published an article that talked about that and asked for anybody who had a person with G6PD deficiency, had trouble with ascorbate, to please contact me. And so far there hasn't been anybody that's done it. Because G6PD deficiency causes hemolysis of the blood when there is an oxidative redox potential. And since ascorbate in large doses causes a reducing redox potential, I can't understand how that happens. Now, it could be that if you had a very serious disease and gave small doses of ascorbate and not enough to reduce the oxidative redox potential, you could have trouble, and then for political reasons the ascorbate would be blamed for it. But my thought at first would be that they didn't give enough to force the reducing redox potential. But I do want to say, you know, about this hemorrhagic fevers, Ebola virus, Lassa fever, Marburg virus, and all these, I think they're like 500-gram diseases, and they should all be treated with intravenous vitamin C. Now, there's this book entitled Fever. I forget the name of it. Maybe it's Fuller is the name of the author. I'm not sure. But anyway, it describes how this one native came into this hospital in Africa, in Lhasa, and within a week the doctors and the nurses and the janitors were dying of this Lassa fever. And the first nurse who survived this was Nurse Pinio. She had a horrible time, but she survived it. And then they used this convalescent serum of hers on particularly the white people that in the hospital administration who came down with Lassa fever after that. But in a footnote in that book, it said that Nurse Pinio was taking vitamins. They didn't say anything else about it, but Nurse Pinio, the first survivor of Lassa fever, was taking vitamins. You know, some of the diseases of the lung, like bronchiectasis, these chronic infections of the lung, they're helped tremendously by ascorbate. Many chronic infections, like, for instance, one of the more spectacular diseases to get rid of is chronic otitis media. You know, you see kids come in that have tubes in their ears, and they've seen many doctors and many antibiotics, and they've been on prednisone and all sorts of other things. And usually after a week of massive doses of ascorbic acid, the otitis is gone. I think what happens here is that the bacteria gets hung up in this bony blind cavern, and the antibiotics and the body can't get at them, and it's sort of a pus pocket where acute induced scurvy in this pus pocket, and so the white cells can't function in there. So that when you give the person massive doses of ascorbate, the ascorbate diffuses into the center of these little pus pockets, and the white cells come out fighting mad and get rid of the infections. But I tell you, I have not seen, so far, knock on wood, I have not seen a case of chronic otitis media that did not respond to massive doses of ascorbate. Now, when they come in and they're on an antibiotic and they've been on it for a long time, I don't take them off the antibiotic right away until the infection is gone. See, one of the troubles with playing brinksmanship with food allergies and blocking symptoms is you may block the immediate symptom of the disease, but then God knows what it does to you next, you see. So that's one of the things that we do in orthomolecular medicine, is to try and find out these food and chemical sensitivities and get rid of them. Now, one of the causes, believe it or not, and there's going to be great interest in this in the years coming, is Lyme disease. Now, people think of that as being the tick bite disease, but it turns out that only maybe half the people have had tick bites. We're finding that saliva and semen and mosquito bites will transmit Lyme disease. And Lyme disease, it used to be that syphilis was the great imitator. Now we're thinking Lyme disease is a great imitator. And people with Lyme disease may accumulate heavy metals just because. And the Lyme somehow or another makes the body accumulate heavy metals. I mean, there was a conference about that in San Francisco just 2 weekends ago. And it just blows my mind as to all the different things that this Lyme disease can be doing to people. And one of the reasons why I'm not an expert on Lyme disease is because, I mean, I figure from listening to the symptoms they were talking about, which are symptoms in common with chronic candidiasis, hypothyroidism, and all these other diseases we treat, is that the reason why I have not recognized them as Lyme disease is my program, my anti-yeast program, and the vitamin C seems to control it just as well as the antibiotics do. So that I didn't then go on and do all these tests on the people like that.
Mexico.
Well, yes, he's in New Mexico, which is a medical freedom state. That is, they can't take your license away for doing alternative medicine. Also, he's a doctor of osteopathy, which means that the MDs can't give him a bad time. And the first patient he cured was the mayor's wife, and then he cured some few prominent citizens of that community, so he's not worried about them being able to get a jury together that convict him of malpractice. Then he has a chemotherapist who will start the central catheters and prescribe the pumps that are carried on the belt, so that he's able to give like 120 to 180 grams of sodium ascorbate for 24 hours in continuous drips for months at a time. And the insurance companies pay for it because the chemotherapist is putting just a trace amount of chemotherapy in this. It's not enough to do anything, but fools the insurance people. And so by you might say, going against the laws of what would be laws in most states and the legal problems involved in doing new things and fooling the insurance people, he seems to be able to be curing just about all cancers. Well, with allergies, my own case of hay fever was markedly ameliorated by the massive doses of C, and I found that useful. Also, not eating sugar. Like, I found that my grass allergies were worse when I ate sugar, you see. And so we put people on these anti-yeast diets, and then with asthma usually with massive doses of ascorbate, we can get 9/10 of the people off all their drugs. Like exercise-induced asthma, if they take the massive dose of ascorbic acid before exercising, they don't have any trouble with that. This raving maniac suddenly became a sweet, lovely thing. It was like Mr. Hyde had turned into Dr. Jekyll. So they threw her out of jail. She went to work for a health food store because she didn't have any money and she didn't want to run out of niacin. And then she heard about me up at Incline Village, and I saw her, took her off sugar. In her case, that didn't do any good. It was just giving her higher and higher doses of niacin. I saw her a month later. She was taking 17 grams of niacin a day. Now, this is the highest dose that Abe Hoffer had ever heard of. He had told me he had seen a patient take 15 grams before. This niacin is this thing that flushes you, but she wasn't being flushed by it. And she was taking 30 grams of vitamin C a day, which may sound like a high dose, but lots of people can take 30 grams. But anyway, she had applied to, been accepted to, and was off to a New York modeling school the next day. And this was 4 months out of prison. If you've interviewed Archie Kalogrenas, he's going to come across much stronger on this, because he had the experience with the Aborigine children that he said that something like when the World Health Organization came around and gave the immunizations to the kids, that within a week something like 10% of the kids died. That, you know, his book, Every Second Child, was 50% of the children died before the age of 1 of these infections and sudden infant death syndrome. So he was very much against the immunization. Well, we know nothing like that happens in the United States. But it shows that when you are in a situation near scurvy, if you take something like a immunization, that's likely to cause a great amount of difficulty. Basically now, if a person has to take immunizations, first of all, I recommend that there be absolutely no mercury in the immunization. That is, that there should be no thimerosal, which is a way of hiding the mercury they put into these things. And the immunizations should have no mercury in them. They should be given one at a time. The child should have no illness whatsoever, should not have any cold, any sniffles, or anything like that when they're given the shot. And they should be supplemented with vitamin C when they're given the shot. And then you don't have any trouble with immunizations.
How much would you recommend to supplement an infant being given an immunization? Is there a guideline you'd say not to give immunizations before a certain age, and how much you should supplement them?
As a matter of fact, we give sodium ascorbate to women that are breastfeeding. They put the sodium ascorbate powder on their nipples, and it helps to prevent the chapping of the nipples, and the kid then takes on that sodium ascorbate. I think that though if you're supplementing them in a food, his recommendation of 1 gram per year, so a 2-year-old will get 2 grams a day.
So even an infant just born, as soon as they're weaned off of the breastfeeding solution, can go to 1 gram.
Yeah,
And,
or if they're not breastfed, put it in their formula.
and what about, do you feel there's a certain age that you should avoid giving an immunization to a child before?
Well, yeah, I mean, why do you give a hepatitis B vaccine to a newborn? I mean, come on. And so one should wait till the immune system is somewhat matured. And I think we would avoid a lot of troubles like that. You know, since I'm not a pediatrician, I do see some children, but I'm not into immunizing at all. I'm not a real expert on this, but various people that I respect, and maybe Archie can give you a better idea about this. We even worry about some cancer-causing bacteria or viruses that might be in the polio vaccines, the living ones and things like that. There was a monkey virus or something of some sort.
The SV40.
Yeah, and so these are reasons to be cautious about it. Now, so then some of the urgency for taking vaccinations is reduced if one learns how to use ascorbate. Now, for instance, like these flu vaccines, if you know how to use ascorbate, there's no reason for taking a flu vaccine. I mean, anybody who knows how to take ascorbate is not going to die from the flu. They're going to ameliorate tremendously, and if you can get the doctors in on this, so that if a person really got sick with the flu, they give intravenous sodium ascorbate, there'd be no problems with the flus. You know, I think the PDR would have to be rewritten. You know, the physician's desk reference, at least half of it is just complications of these drugs. And a lot of these complications are induced nutritional deficits. And we would find that if we would megavitamin with this and that nutrient, particularly vitamin C, that a lot of these drugs would be better tolerated. Not that I want to push the drugs, because if you give the nutrients properly, you probably wouldn't need the drugs in most cases in the first place, but that one would be more tolerant to the drug if they took the nutrients. Well, all I can say about that is that I and Oscar and, well, Linus Pauling went up to testify, and I think Irwin Stone testified. It had to do with this treatment for, I think it was heroin addiction or something, a little kit he had, these vitamin C kits that he was advertising as a treatment for these drug addictions. And, you know, our experience would be that they worked. And so we just testified to that effect. But then they didn't pay much attention to that. And, so they took Oscar's. Well, I don't know what they did to him. He'd have to tell you more about that. But he got very discouraged. He was a big mover in orthomolecular medicine before that happened. Yeah, okay, well, as I say, I think that anaphylaxis is acute induced scurvy. So that what happens is the condition that caused the reaction causes this sudden depletion of vitamin C in the body, and that then allows for this reaction to take place. Now, you know, Archie Kalokerinis with his every second child, these kids were dying of sudden infant death syndrome. And you take all of the different causes of sudden infant death syndrome, minorities, poor, just getting over a cold, wintertime, all of them are things that result in low vitamin C levels. So if you give these people supplemental vitamin C, you don't get sudden infant death syndrome. But Archie's the expert on that. I have never seen a case of sudden infant death syndrome, and because we have all our kids on vitamin C. But I can't say that my practice is large enough of kids that I am absolutely sure that I wouldn't have had one by, yeah. Then the food and chemical sensitivities. Now they're a lot of work. You have to take a very careful history there and figure out what foods they're sensitive to. Some of the tips are that when a person craves, they may very much crave the very food they're sensitive to. Or quite obviously, if they know that they're have a bad reaction to a food, you can't do that anymore. Uh, Sugars, they're not allergic to sugars, they're allergic to what grows on sugar and allergic to the nutritional deficit induced by sugar. So sugar is just forbidden for all of these allergic people, you see. Not that, and so the other thing about that is that so the test will not show that they're allergic to sugar, but you got to stop it anyway. And then there are just food sensitivities that are just flat out poisons. It's like if you ate arsenic and died, you wouldn't say you were allergic to arsenic. And that seems to be like with the nightshades. There's a toxin like in potatoes called solanine, which is first cousin to atropine and scopolamine. So tomatoes, potatoes, eggplant, red and green pepper, paprika, and tobacco don't necessarily show up on any allergy tests, but they will cause reactions. So as I say, working up food and chemical sensitivities is a lot of work, but history is the most important thing. For the chemicals, you have to ask them about, are they better at work or at home, or and if they go on vacation, are they better? You start worrying about things like molds in the houses. You worry about gas in the houses, on the jobs. You think about chemicals. I've had people allergic to their computers. The outgassing of chemicals from their computers. And now, as far as chemical sensitivities are concerned, massive doses of ascorbate will take the edge off of a lot of them so that they become functional. But still, it's not perfect. And although we've had people with chemical sensitivities become 80–90% better, I still want them to avoid those allergic reactions. I agree with Archie Kalkaridis that the cause of sudden infant death syndrome is acute induced scurvy. I don't see it very much here, but any place where you have poor diet and multiple immunizations and colds and stuff like that, you're likely to have this happen. Here in the United States, it's not too common because we get this tiny amount of vitamin C in our diet, whereas the Aborigines were totally without vitamin C almost, and which is an interesting paradox because the history of vitamin C, it was the first one of the first double-blind studies in medicine was done by this fellow named Lind, who was a surgeon in the British Navy. And he did this study and showed that people who ate these fresh fruits and didn't get scurvy. And in fact, during the war with France against Napoleon, they used it as a secret weapon. And Napoleon knew that the British Navy was such and such a size, and so they could have their ports blockaded for a certain period of time, and then they have to turn the ships over because the sailors would be dying of scurvy. Well, he didn't know it, but the British Navy, the limeys, were out there drinking lime juice. And so they sat there and sat there and sat there, and it essentially tripled the size of the British Navy. Well then, Captain Cook, who was the first captain who circumnavigated the globe, he had a reputation of being an SOB, but everybody wanted to ship out with him because he had this obsession with stopping in every port and collecting fresh fruits and vegetables. And so no one ever died of scurvy who shipped out with Captain Cook. And he discovered Australia, and interestingly, and then the ancient Australians, the Aborigines, would worship large trees and their nature. They lived with nature, and they knew that the population should be so much, and they had all these natural ways of living. Well, then when white man's food was introduced into Australia, then scurvy started to get rampant there. And so it's just paradoxical that Captain Cook, who was obsessed with fresh fruits and vegetables, discovered Australia and created the situation where the Australians, Aborigines, got scurvy. And that's another thing, is that, see, it used to be thought that all these allergies were IgE mediated, and that's immunoglobulin E, the antibody of the E family, and so that the scratch test would show that. So the allergist would give shots for hay fever, grasses, trees, weeds, cats, and things like that. But the food allergies are mostly, a lot of them are IgG, which didn't show up on the IgE test, Well, so then there are the IgE tests, or IgG tests, but then some of them are like deficiencies of IgA. IgA, imagine a situation where the body secretes antibodies into the gut that prevents the absorption of a substance that would cause an allergic reaction if it was absorbed into the body. So the deficiency of IgA would cause trouble, and I don't know of any specific tests for that. There's general tests for deficiencies of IgA. Abe Hoffer discovered this thing about niacin, and then he added vitamin C to it in the treatment of schizophrenia. Then one of his colleagues, Carl Pfeiffer, discovered this thing about how some schizophrenics are helped by B6 and zinc. So it's a different cause. So that wouldn't be the pellagra who was helped by B6 zinc so much, I don't think. See, the person with pellagra can't convert tryptophan to niacin. And so, pellagra is the 4 Ds. It's death, diarrhea, dementia, and dermatitis. And so they would develop all those symptoms. But there are other schizophrenics that really do better by using the B6 and zinc. And then there's another group of schizophrenics that will do better by finding out food allergies. So like sometimes schizophrenia can be the result of a food allergy. Like for instance, gluten sometimes causes schizophrenia. Well, while we were talking about allergies, I wanted to talk about scarlet fever. In my experience, scarlet fever is absolutely the easiest disease in the world to cure. I'm talking about a few hours. Now, scarlet fever is caused by an allergic reaction to strep toxin. And usually, the strep is gone by that time. Usually the person has had something like a strep throat or some infection of the skin or something which has been treated with penicillin or some other antibiotic, and the strep is dead. But there is a residual amount of strep toxin left in the body that the body has an almighty allergic reaction to. Well, my experience is that when a patient comes in with this typical rash of scarlet fever, that you give them ascorbate, and if you give it intravenously, within a few hours the rash is gone, and it's permanently gone. You see, the thing is that with most diseases, you've still got a little bit of the bug left inside making the toxin still, whereas in this case, the toxin is all gone. Once it's neutralized, that's it. Now, since I have not seen a case of rheumatic fever, I would assume that the same thing would happen. Since rheumatic fever is another allergic reaction to strep toxin, then the ascorbate will neutralize the strep toxin. Now then there's the treatment of beta hemolytic strep. Now, I have had this type of thing happen to me twice while I was up at Incline. A mother would bring in their 6-year-old kid and say they have a bad sore throat, and I was suspicious of strep, so I would do a throat culture and give them a prescription for some penicillin orally, and tell them how to take the vitamin C and the probiotic, the acidophilus, and then send the child home. And then 2 days later, when the culture came back, the beta hemolytic strep, I would call the mother and say, well, how's Johnny? Oh, he's all well, he's back to school. I said, well, you gave him the penicillin, didn't you? And they say, no, we were waiting for the culture, we just gave the vitamin C. So now, for legal reasons, I would, if I knew it was strep, I would not dare not use vitamin C, not use penicillin, but there's some question in my mind still whether or not it's necessary and whether or not ascorbate will take out the strep all by itself. Maybe it will, maybe it won't. For legal reasons, I'm not going to make a definite statement about that. But I think it would be an interesting thing for investigation. His name's Joseph Breslin, and I forget exactly the town that he's in New Mexico, but I had talked to him over a few times in the past year, telling him that I thought that the ideal treatment of cancer would be by using one of these pumps and putting it in through a central catheter. See, the problem is that if you have to start IVs in the arm all the time and give it day by day, you're likely to lose some of those veins. I mean, it's not as bad as the chemotherapy, but you're not able to give these huge doses. Plus the fact, with the malpractice ripoff over our heads all the time, we're afraid to do anything that's not practice of the community. See, we've got a situation with medical malpractice is we're judged by what's considered practice of the community. And when you go to a doctor now, let's say probably 90% of what he does was not practice of the community 100 years ago. So all progress depends upon non-practice of the community, whereas we're held to practice of the community by the law courts. So the first doctor in town who does something new is not practicing practice of the community, and the last doctor in town who does something new is not practicing practice of the community. So if we stop all progress, we get so practice of the community, we can't get sued. So no malpractice attorney is able to rip us off and pay for their house payments. See, but the problem is that people are dying wholesale because of this greediness of the attorneys. Okay, well, there is this controversy about oxidation versus reduction in orthomolecular medicine right now. And there are people who would seem to imply that ozone and peroxide directly cure bugs, like they'll give intravenous ozone and peroxide, and you're picturing that it directly kills bugs inside the body. And I don't think that's what's happening. I think it stimulates various components of the immune systems to somehow fire up the immune system to kill the bugs. And so I don't detract from the treatments at all. I'm just criticizing the reasons, because this then has gotten over into how ascorbate works. Now, the way a white cell kills a bacteria is in a process called a respiratory burst. The white cell engulfs the virus, bacteria, fungus, or parasite in a vacuole, and then it takes O2, or molecular oxygen, and reduces it with a hydrogen, forming peroxide. And the peroxide joins with water, forming peroxide, and then that peroxide joins with chlorine to form hypochlorous acid. And this is excreted then into the vacuole and kills the bacteria, fungus, or parasite. Now, and then sometimes the white cell will let loose with a broadside against a cancer cell. And all this then, the killing power comes from this oxidation, which is originally formed by reduction, which is just the complete oxygen, but opposite, it's the reduction of oxygen. So there's some confusion about this. Now, when these oxidizing substances get loose in the body, they cause inflammation, and that's when there are free radicals. And that's when the ascorbate, as a reduction substance, neutralizes those free radicals and cuts down on the inflammation. I mean, the idea that you could give ozone and peroxide in concentrations sufficiently to directly kill the virus and bacteria within the body just per se, I don't think is right. I think it stimulates the immune system somehow or other to do that. But the point is then that this has made it so that they think that ascorbate then is an oxidizing substance, which it isn't per se. It is not an oxidizing substance, but it might provide the reducing power with which the white cells then convert the molecular oxygen into superoxide and set this whole thing off. Well, see, the problem is, particularly right now, is with hepatitis C, because only about a quarter of the cases ever present acutely. 3/4 of them, they'll show up with during a physical exam or something else, that they've got these difficulties with the enzymes elevated, and then they'll be diagnosed with chronic hepatitis C. Well, our experience has been that massive doses of ascorbate will not all by itself take out chronic hepatitis C. We put them on the no sugar diet, the anti-yeast program, give them, of course, the bowel tolerance doses of vitamin C, zinc, manganese, chromium, selenium, cod liver oil for the A and D, and a multiple B vitamin, And then on top of that, we give them some silymarin, which is an herb which helps the liver. And now more recently, we've been using alpha-lipoic acid. There's several studies in Germany showing where alpha-lipoic acid will help with liver problems. And so our experience with this is that these people just go on. Their enzymes go down to just slightly elevated. And as long as they stay on the program, they don't have any trouble. They're perfectly healthy. In fact, seem perfectly okay. I have not had any patient ever die of hepatic necrosis or get liver cancer on this program. I've had patients who have failed alpha interferon, and they do just fine on this program. Now, I'm not saying that they revert to negative, although there was one patient who said, apparently did, but then again, but most patients don't, but their life is perfectly livable, and they're perfectly healthy on this. Now, acute hepatitis, A, B, C, I don't care what, intravenous sodium ascorbate just knocks the blazes out of these diseases in 3 or 4 days. Now, I would always follow him with bowel tolerance doses of vitamin C for maybe a month or so after that. I think that hyperactive kids are adrenaline kids, you know. They're having food and chemical sensitivities, and the sugar is driving them crazy. I mean, every school teacher will say that their class goes crazy after the lunch, and the kids are sitting there eating all this junk food for lunch. It's the sugar. And the body, to regulate blood sugar, then puts out adrenaline. And so anyway, we get these kids with hyperactivity off the sugars, and then we look for their food and chemical sensitivities, because it may not be just sugar. It may be certain chemicals. I remember the Feingold diet, which was vogue years and years ago. Feingold worked for the Kaiser across the bay, and I can remember going to a conference where one of the residents that worked with Feingold said that one day he came into the old man's office, and he had this book on his desk, Sugar Blues, and he said when Feingold came in the office, he said, "Sir, you think that sugar has anything to do with hyperactivity?" And he paused for a minute and said, "Of course it does, it's the prime cause. But when you take kids off of all of the food colorings, you take them off of 90% of the sugar, and you don't take on the giant." So Feingold was very aware of the fact that sugar was the main problem with hyperactivity, but he concentrated on the food colorings so the sugar industry wouldn't go after it. An interesting sidelight here is that there is this vet in San Jose, Wendell Belfield. I think he's in partial retirement now, but for 20 years he has been curing dogs of distemper and kennel fever. Now, it turns out that, see, dogs don't get colds and flus, but if they get a more serious disease that overcomes their ability to make ascorbate, then you can even help them out with intravenous sodium ascorbate and cure them. So he was able to cure distemper in dogs by running an intravenous sodium ascorbate for 2 or 3 days. This brings up one of the other pieces of jargon we use. I talk about like 50-gram coals or 100-gram coals. A 100-gram cold is a cold that allows you to take 100 grams at the peak of the disease without it producing diarrhea. So imagine a 500-gram disease, and that's what probably distemper is. So that maybe a dog can't get a disease unless it's over 200 grams, but it could get a 500-gram disease, and so that you can cure them with intravenous sodium ascorbate. Now, one of the other interesting things about this, although I have not seen a case of this, but Ebola virus and the hemorrhagic fevers are probably like 500-gram diseases. They're so severe that they cause sudden scurvy in the body. Of course, they bleed from every orifice and their organs and so forth, and then die at this high temperature and all this bleeding. Well, it would be quite logical to give them intravenous sodium ascorbate as soon as they got the disease to reverse this scurvy. And I'm quite sure that a very high percentage of people with Ebola virus would survive if they were given intravenous sodium ascorbate as soon as the disease starts. Molecules have you might say, every atom has a nucleus and it has then electrons around that. And the protons should balance the electrons. Well, when you lose an electron, then that makes that chemical very reactive because it wants another electron back. So you'll have two chemicals that join together. Like, for instance, hydrogen and oxygen join together to form water. The hydrogen is sharing electrons with the oxygen, and so they stick together, and that makes the water molecule. Well, but if during a disease process or some abnormal reaction within the body, an electron is just lost, then that becomes a free radical. That molecule is sitting there with having lost an electron, and it will glom onto just anything. And so that if it's sitting next to some sort of a protein, it will glom onto that protein and cause some part of the disease or symptoms. So the ascorbate molecule itself carries 2 extra electrons in its outer ring. When the electrons are given up, it becomes dihydroascorbate. So that every molecule of ascorbate has the ability to give up 2 electrons, and then actually when it breaks down completely, probably it can release 2 or 4 more electrons. But in any event, these electrons neutralize the free radicals. Now, ordinarily, the body's metabolism comes up with these electrons in the mitochondria. These are these little organelles within the bodies that make ATP, which is what provides the energy for muscles to run on, but they also provide chemicals that refuel the vitamin C. So the vitamin C is used over and over again. But the mitochondria can only do this at a certain rate. And here is the key, is that the body has the ability to provide these electrons only at a certain limited rate. And if this rate is exceeded, then inflammation occurs. That's when we get sick. Whenever we get redness, swelling, or pain in any part of the body, at least in that part of the body, the ability to supply the electrons to neutralize those free radicals have been exceeded. So that if we literally flood the body with vitamin C in those areas, we will neutralize those free radicals at that point. I mean, there's some people, if you've interviewed Archie Kalogerinas, he's going to come across much stronger on this because he had the experience with the Aborigine children that he said that something like when the World Health Organization came around and gave the immunizations to the kids, that within a week something like 10% of the kids died. You know, his book, Every Second Child, is 50% of the children died before the age of 1 of these infections and sudden infant death syndrome. So he was very much against the immunization. Well, we know nothing like that happens in the United States. But it shows that when you are in a situation near scurvy, if you take something like a immunization, that's likely to cause a great amount of difficulty. So basically now, if a person has to take immunizations, first of all, I recommend that there be absolutely no mercury in the immunization. That is, that there should be no thimerosal, which is a way of hiding the mercury they put into these things. And the immunizations should have no mercury in them. They should be given 1 at a time. The child should have no illness whatsoever, should not have any cold, any sniffles, or anything like that when they're given the shot. And they should be supplemented with vitamin C when they're given the shot. And then you don't have any trouble with immunizations.
How much would you recommend to supplement an infant being given an immunization? Is there a guideline you'd say not to give immunizations before a certain age, and how much you should supplement them?
As a matter of fact, we give sodium ascorbate to women that are breastfeeding. They put the sodium ascorbate powder on their nipples, and it helps to prevent the chapping of the nipples, and the kid then takes on that sodium ascorbate. I think that though if you're supplementing them in food, his recommendation of 1 gram per year, so a 2-year-old will get 2 grams a day.
So even an infant just born, as soon as they're weaned off of the breastfeeding solution, can go to 1 gram?
Yeah, or if they're not breastfed, put it in their formula.
And what about do you feel there's a certain age that you should avoid giving an immunization to a child before?
Well, yeah. I mean, why do you give a hepatitis B vaccine to a newborn? I mean, come on. And so one should wait till the immune system is somewhat matured. And I think we would avoid a lot of troubles like that. You know, since I'm not a pediatrician, I do see some children, but I'm not into immunizing at all. I'm not a real expert on this, but various people that I respect, and maybe Archie can give you a better idea about this. We even worry about some cancer-causing bacteria or viruses that might be in the polio vaccines, the living ones and things like that. There was a monkey virus or something.
The SV40.
Yeah, and so these are reasons to be cautious about it. Now, so then some of the urgency for taking vaccinations is reduced if one learns how to use ascorbate. Now, for instance, like these flu vaccines, if you know how to use ascorbate, there's no reason for taking a flu vaccine. I mean, anybody who knows how to take ascorbate is not going to die from the flu. They're going to ameliorate tremendously, and if you can get the doctors in on this, so that if a person really got sick with the flu, they give intravenous sodium ascorbate, there'd be no problems with the flus.
Yeah, sure.
Okay, that's 1 cc B12, 1 cc folic acid, and 1 cc B100.
And that's taken how often?
Well, ordinarily, I try people out twice a week and see whether or not they get a kick out of it. By that I mean if they feel better, then if the better feeling lasts for a week, they take it every week. If it lasts for 3 days, they take it every 3 days. Now, I have found about 3,000 patients that seem to benefit from this, and during that time I found 3 cases of pernicious anemia, which is the known deficiency of B12. And interestingly, some of these people that benefit from B12 shots actually have high serum B12s before given the shot, and this implies that there's something the matter with the B12 metabolism, and it takes super high doses for them to get the full benefit. But anyway, since I use the B12 and the folic acid together, I'm not really sure. Maybe some of these people are folic acid problem people, and they're getting effects from that. All the animals except for man, monkey, and the guinea pig make vitamin C. This is literally why a dog can eat dirty things off the ground, why they can bury a bone, let it rot for a few days, and then dig it up and eat it. Because they make ascorbate just like we make saliva, and this ascorbate neutralizes the free radicals that are involved in all these toxic products. Well, we humans don't make ascorbate, and actually the history behind this is probably that about 65 million years ago, plus or minus a few million years, the higher primates up in the trees where dirty things were falling to the ground, and we had developed arms and hands to pick up clean things, and were living in sparse populations, that one of our distant cousins was born that didn't make ascorbate and survived to reproduce, and had this interesting advantage. You see, these other animals don't make ascorbate for free, they make it from glucose. So maybe 20% of the food that your dog or cat is making or eating goes into making ascorbate, whereas humans don't waste glucose on making ascorbate. So that in times of famine, like in the Ice Age or so forth, we humans can outstarve most animals. I mean, we don't like to starve, but when you see the pictures of like the people at Dachau, we see how terrible the starvation can be, and people just live on and on and on without much food. Whereas wild animals will eat themselves up making ascorbate. They're better, they don't get colds, like dogs don't get colds or flus or things like that, but we can outstarve them. Anyway, that was the advantage for humans not making ascorbate. And now we're stuck with it. Now that the humans have come out of the trees and live in these large civilizations and can spread diseases around a lot, then it would be nice to have that ascorbate making mechanism back. Now actually, when we start talking about naturalness, I want to point out that we can fly higher and faster than birds in our machines. We can also make more ascorbate with our machines than a dog can. And so we just have to have the knowledge of how to take it. And we can take this ascorbate that is made in our chemical plants and be actually more resistant to diseases than dogs are. Oh yes. Well, now when I met Archie Kalokerinis from Australia, he came over, Oscar had him over, and we started talking about these things, and we all observed the very same things that independently he had discovered in Australia and I discovered here. Now he had the advantage of seeing more of these kids who really had acute induced scurvy. I mean, they were terribly scorbutic to begin with. So that's where his title of the book, Every Second Child, came along. Now, in this country, fortunately, we didn't have that much trouble. The kids don't have frank scurvy, but they sometimes will have problems. Now, Archie described this one case, that the exact same thing that he described happened to me. This had to be about 1975, is that this mother brought in her kid, who had a 2-year-old, who had a temperature of 104. And we gave him a penicillin shot, just to be sure, despite the fact that I thought it was viral, and told him, mother, to give vitamin C, and sent him home. And about 2 a.m. that night, I get this telephone call, and the mother says, I think he's dying. And I said, well, did you give him the vitamin C? No, he won't take it. He's 2 years old. So I said, well, meet me down at the office. And in the midst of a snowstorm, he came down. And here this kid was practically unconscious with his back arched. This is called episthetosis, and it's one of the symptoms of scurvy. And I was talking fast and drew up the sodium ascorbate and gave him a shot, 2 C's of sodium ascorbate in both buttocks. And before I could get the second shot completely in, he's sitting up looking around talking. It was just like that. And that kid would have been dead in a few hours. If I had sent him to the hospital, he would have died, I think. Now, I'd like to start from scratch on that question, because what I think is, that see, all the time there are all these billions of reactions going on in the body, where chemicals are breaking up and joining together, and their enzyme reactions, and everything is under control in the body. And that every once in a while a mistake is made when a chemical breaks apart. One chemical may take an electron from another one and not replace it quite right, and then that's a radical. Well, ordinarily when you're well, the small amount of radicals that are formed are handled by the free radical scavenger system, donating an electron to neutralize that free radical. But when you get sick, then there's gross damage, gross mistakes, huge amounts of these radicals that become free radicals that are formed, and your own free radical scavenging system can't take care of that, you see. And so that's where the massive doses of ascorbate come in. But then you see, what happens is when the little amounts of ascorbate that the normal person has in their body tries to neutralize the free radicals. Remember, I'm saying that as ascorbate neutralizes free radicals, the free radicals neutralize the ascorbate. Then the ascorbate is destroyed, and the person gets an acute induced scurvy in the tissue involved in the disease. Maybe not all over the body, but in the tissue involved in the disease. At which point the white cells shut down. See, the white cells need a little bit of vitamin C to fight. And so you get this sort of acute induced scurvy, like in the throat when you've got a cold, or in the liver when you've got hepatitis. And so the white cells just shut down. Now the only thing that saves us is the secondary system of antibodies. And antibodies are turned on by free radicals, see. So that otherwise we would die of a cold, you see, but after a week to 10 days the antibodies finally build up and knock off the cold virus. But see, so that's why there's that delay. You either, if you get well right away, it's either previous antibodies or the white cells knocking it off. But then you go into that period where it lingers until the antibodies build up again. Now during that period of extended period, If you take massive enough of the ascorbate to drive the ascorbate back into the nose and throat, then you may get lucky and the white cells may come out fighting mad and get rid of the cold once it's established. See, one of the ideas years ago was that if you took vitamin C early enough that it would work, but once the disease really got going, it wouldn't work. Well, the reason for that was that they didn't use high enough doses, you see. So if a disease is already going, to take that on, you've got to use absolutely unthinkable massive doses as far as the orthodox mind is concerned, you see. Then it neutralizes those. Yeah, well, about 1983 was when I first heard about AIDS, and I had to try vitamin C on it because it had been so successful with all the other acute viral diseases. Now, this turned out to be a key, is that AIDS is not an acute virus, it's a chronic virus. But then I would take the people to bowel tolerance and get them off sugar and give them the zinc, manganese, chromium, selenium, cod liver oil, and the B vitamins. And it was definitely prolonging their life, but it wasn't curing it. Intravenous vitamin C would cut down the Kaposi sarcoma. It was pretty amazing. You know, early in the AIDS epidemic, at least half the people in San Francisco had Kaposi sarcoma, and when you gave these patients intravenous vitamin C, the Kaposi's would fade away. But anyway, see, I'm down the peninsula from San Francisco, and I was going up to San Francisco to treat these patients, and finally it was getting too expensive for me. So we sort of came out that only the patients that came down the peninsula I would be seen. See, well, I had this one young gay guy who came in and he approached me differently than anybody else ever had. He said, "I have a lot of money, I'll do anything you say." Well, I was waiting for this, and he hired special nurses, and he got intravenous vitamin C 60 grams a day. Oh, he came in with a T helper cell count of 5. And so he went on all this program I was describing. He was taking up to 200 grams of ascorbic acid a day, regularly taking 100 grams a day of ascorbic acid plus 60 grams intravenously. In 3 months, his T helper cell count was up to over 500, which was normal. And now, he's still alive today as far as I know. I saw him about 2 years ago. He was moving back east, and he was in perfect health, except that he was still HIV positive. At this point, I stopped seeing AIDS patients, because if a person comes to me and I can't afford to treat them and they can't afford the treatment, and the insurance companies won't pay for the treatment, then I just can't bear to treat the patients. So I wrote this up and sent it to various different gay magazines and try to get them to publish it, but they wouldn't.
And how long ago was it that you originally treated him when he came in with this count of 5?
It was about 1985.
20 years ago.
And he has actually gone up to, now understand, in 85 he had a T helper cell count of 5. So 3 months later he's over 500. He has been up, he's tried various different things. One thing he tried was this AZT, and early on the doses were so high that they knocked his white count down, way down, and so we had to save him with the triple B shots I was talking about. We got him out of that, and now he says he does go up and he gets the triple therapy in San Francisco sometimes, and he says he'd be sitting in the waiting room with his gay colleagues who are dying of liver failure and kidney failure and so forth from the drugs, and he says he's never had any trouble whatsoever with any of these poisons they give him because he takes these massive doses of ascorbate all the time. Okay, well, one of the reasons why ascorbate is such a panacea, and it's criticized for that reason, is that when you look at humans and life in general from a very way up there philosophically, is that we are these organic machines operating in this oxygen atmosphere that we have to burn for energy. But then we have to keep ourselves from being rusted or oxidized by this oxygen atmosphere. You know, like if you cut an apple in half, it turns brown very quickly. Well, that's because it's being oxidized. Well, we have this antioxidant system within our body that prevents us from being oxidized. Well, various different bugs have discovered that by making more oxidants, free radicals, that they're able to defeat our antioxidant system. And so that's why we get sick. Well, the ascorbate, by augmenting our natural antioxidant systems and making them far more powerful than they ever were just naturally in nature, then prevent this oxidation. And so that's why we're able to prevent a lot of diseases with the massive doses of ascorbate that were otherwise not treatable before. Now, 20 years ago, no one would have believed that any cancer was being caused by an infection, but now I think it's like Kaposi's, we know that, and then there's certain types of leukemias that are caused by viruses and so forth, and I would expect that we would find that vitamin C would be effective in preventing those kinds of cancers. Like, for instance, there's some cancers of the liver, I understand, that were common in Japan, and I think in Linus Pauling's book he mentioned this, about one of the Japanese doctors had given vitamin C to patients after surgeries, after blood transfusions, and didn't have any difficulties with hepatitis or cancers of the liver after that.
You concur with him about the cause of SIDS?
Oh, absolutely. And if you can, he tells the story about how when he first went there in this province of Aborigines, that 50% of the kids died before the age of 1, and they were walking around with, we had infected eyes and ears and throat and so forth like that, and then they just die in their sleep, or they might have this episiotomus and go out that way. And he got so discouraged that he quit and went into opal mining, and one day it hit him that it was scurvy, and so he came back and he gave all the kids vitamin C, and he said he dropped the death rate from 50% to 0, except for falling out of trees and drowning. And right now he's on a campaign that a lot of these kids and parents that are going to jail for supposedly killing their kids with shaken baby syndrome, is that what has happened is that these kids were either chronically ill with colds or flus, or given immunizations and so forth, which cause acute scurvy, and then you just touch them and they bruise, and they may bleed from hemorrhage and so forth like that. And since the medical profession doesn't recognize this, they said that the parents were beating on the kids. Well, so a lot of these people, good people, have been put in prison for life for supposedly killing their kids. And they didn't kill them at all. It was acute induced scurvy that killed them. And that's happening here in the United States. Well, as far as in the treatment of AIDS is concerned, back when I was treating a lot of AIDS patients, we found that the intravenous vitamin C had a marked effect on Kaposi's sarcoma as far as knocking the lesions down. Also, it would bring up T helper cell counts. Intravenous vitamin C would. Oral vitamin C with all of the anti-yeast program and all the other nutrients would help and bring T helper cell counts up. But see, part of the problem here is that I wasn't quite sure how fanatical these patients were with following the instructions. There was no question that in the patients who absolutely went on this program, they went into profound remissions for long periods of time. It was almost as if a patient survived the AIDS long enough that they seemed to then be one that it wasn't going to take them out very rapidly. I'm being a little bit vague here, because I sort of lost interest in AIDS when I realized that intravenous vitamin C would really have a profound effect on on the AIDS, and I was unable to press that for legal and insurance reasons. I know that's not satisfactory.
Some ski instructors that continue doing their work while
oh yeah,
through
mononucleosis. They were carrying their boga bags full of vitamin C, and they would be yodeling down the slopes while drinking the vitamin C while they had mononucleosis. Now, until the spleen enlargement goes down, I wouldn't recommend that, because you might burst the spleen, but no, it went down, right down. See, all these inflammations are mediated by free radicals, and if you get enough ascorbate into the diseased tissue, it will eliminate those free radicals. See, what I object to are these studies that are talking about blood levels. I don't care what the blood level is. I care what the level is in the diseased tissue. You know, that brings up the question of how long people want to stay on these maintenance doses. I tell you, once a person gets on bowel tolerance doses of vitamin C and gets on maintenance doses, we generally don't have to talk about that, because the patient knows what benefit they're getting. Like, patients will come in and say, I didn't tell you this, but one of my big problems with life has been chronic sinusitis. And since I've had the vitamin C, I don't have any chronic sinusitis anymore. So they just keep it up to keep rid of the chronic sinusitis, you see. And since it reduces the incidence of colds tremendously, they feel so much better. They need less sleep, maybe an hour less sleep. And all these things are good things, and so you don't have to twist the person's arm to take the ascorbate. They just want to take it. But then Hugh Reardon of Wichita, Kansas, came up with this theory about it producing peroxide in every cell of the body, and that would destroy the cancers. Well, it's become obvious as we have been playing around with increasing the doses that the fact that some cancers didn't respond was just a matter of amount, that we needed to use higher and higher amounts of ascorbate. Well, but the malpractice ripoff and the regulations and all that have prevented us from doing this. I must tell you, with all my experience with use of ascorbic acid orally and sodium ascorbate intravenously, I really don't know what a toxic dose would be. I mean, I have run in 180 grams of sodium ascorbate in myself in 8 hours when I was perfectly well and felt great. And so I suppose you could finally drown in sodium ascorbate just like you can drown in water. But as far as we can tell, it's a totally non-toxic substance in the usual sense. So that if, with certain cancer patients, I'm not going to be satisfied that we have done our best until we literally pickle the person with sodium ascorbate, and then see what happens. All these figures and this work was done before the triple therapy came out. And I'm not going to put down the triple therapy completely. I think that now, short of the intravenous vitamin C all the time, I think that this program would ameliorate the symptoms of the triple therapy so much that it would be a great addition to it. In other words, I think that you wouldn't see the kidney failures and the liver failures and so forth like that if they were on huge doses of C and the other nutrients. So I would say that really this is how it was in the 1980s, and now in the 2000s with the triple therapy, they do work to a certain extent. You know,